All right, here we go, everybody. Welcome to the annual Developmental Disabilities Community Notebook Meeting. I'm super excited this morning to welcome you here. The 2026 legislative session begins January 12th and it goes through March 12th. This legislative session is a short 8-week, fast and furious session. Buckle up because it's going to be a very interesting one. This is our kickoff meeting. So today you're going to hear a lot about issues that we think are going to come up during session. We're going to provide some newer statistics and data and information if we have it. We're going to preview some possible legislation and welcome a number of VIP guests, including legislators and other policy staff who will work on our issues over the session. So we may have some guests popping in and out for just part of this, so bear with us. For just a moment, I'm going to take up just a second to do some housekeeping. So most of you are really familiar with this, but let's just make sure everybody knows. First thing you should do is make sure that you check whether you're going to get access to an interpreter through language access. So if you would like access to this in Spanish, you can click something other than English, but it's helpful if you go to the globe button down below and click English, even if you're just listening in English, because it helps the interpreters manage everything behind the scenes. So do that first. This meeting is being recorded, as you know, and it will be posted on the Arc of Washington website very shortly after we do just a little bit of cleanup and editing. There'll be captioning available in English, and if you go down to the captioning or the transcript button, it can change the language for you, I believe. So we'll give that a try. We are going to avoid using the chat box for conversation if at all possible. Please don't have separate conversations in chat. If you have a question for one of our guests, there's a Q&A button down below. So it's got a little question mark and a little box. You can ask a question of one of our guests or ask a question generally, and one of our monitors will catch that and will read it out loud. Okay. Please mute if you can throughout this. If you're making a lot of noise, we might mute for you. There are some people who leave it off mute for accessibility reasons. That's totally okay. But again, if it starts to interrupt the presentation, then we might mute you quickly. We can't unmute you, so make sure you know that and check before you speak if you're on mute or not. Okay, that's our housekeeping, I think. Unless I missed something, Kathy, you can make sure everybody knows.
The only thing I say is if you joined us and your name appears as my name, I know I was joking earlier. Yes, there's times I want to clone myself, because but only when I'm doing housework. But it's because you have the direct link, then you're using my link. So if you would change your name on the thing, that would be great. And for those that are monitoring the entry buttons, those are most likely could be one of our guest speakers too as well. So watch for that name, please.
Great. And we do have a few folks who are monitoring the chat. I just want to make sure you know who they are, and we'll help you with any concerns or problems if you want to reach out to them. That's Taylor Crisp and Eric Mathis, both former co-chairs of the Community Advocacy Coalition, and Christy Childs with the Developmental Disabilities Council, along with Kathy Marahashi, our public policy specialist who needs no introduction. Everybody knows Kathy, the Arc of Washington State. And now I'm going to turn it over to Brandy Motz just for a minute to do a little introduction of herself.
This is Brandy. Thank you, Stacy. Good morning, everyone. I'm Brandy Motz with the Washington State Developmental Disability Council. I'm the executive director of your council here in Washington State. Just a little bit about the council. Every state in our country has a council. The governor selects the people who sit on it. Right now we have 25 people. We're made up of people with disabilities, family members, and then the state agencies that provide services to that community. We have a 5-year state plan, and we're in the last year of our plan right now. So you'll see my coworker, Emily Rogers, come on in a while and share some information with you about what we heard from the community as we started to prepare for the next 5-year state plan. There's a lot of concern from the community around crisis, people going into crisis and getting stuck in facilities they don't want to be living in. So our council right now is focused on making the new plan that will start in October of 2026. And you'll hear a lot more about that. And finally, I just want want to thank the ARC of Washington. I know they've been doing the notebook meeting and facilitating the Community Advocacy Coalition for a really long time. And I think I'm really proud when I go look around at the rest of the country. Washington State is doing much stronger work, I think, from a community perspective than a lot of other states, because we have so many folks like you who are showing up and participating, helping our legislature understand what we need and where the holes are in our community. So thank you, ARC of Washington, and thank you, CAC members, and thank you everyone who came today to spend time learning more about what our community is saying they need, and then helping us figure out how to message that to our elected officials coming up here in legislative session. Thanks so much.
Thanks, Brandy. So many of you know, if you don't know, we call this the notebook meeting because back in the day, we used to have a physical notebook. We printed out hundreds and hundreds of pages, and we had this meeting in person only before the invention of Zoom. And everybody got a notebook. That's why it's called that. And every time we try to change the name, people are like, no, we like that name. It's nostalgic, and we think it's great to remember the notebook. So for those of you that are scratching your head over why it's called that, just a little bit of history. But the notebook is still really important, and it is available online and electronically. You can get all the statistics and information, even listen to the speakers again on the ARC of Washington's website. And Kathy's going to give you just a minute to learn how to navigate that. And so Kathy's going to pop on for a second and show everyone.
Yeah. So I just put the link to the notebook page in the chat box. So you can click there and go, and you'll come to well, maybe I should share my screen. Hold on. It might be easier for you to see that way. And
some people like to follow along, even though we'll show slides, you can follow along separately this way.
Sorry, it's going to take a second for it to.
We see your.
Well, actually, I'm going to do it here. Okay, share. You still see the PowerPoint?
We see a different version of your PowerPoint.
Okay, start. Let me stop sharing. Share. I'm going to go here. I'm just going to go straight to the front page of. So here is the front page of our website. Hold on, I can still see you guys. Okay. So if you go to advocacy, and it's dropped down, we've got a little hiccup, so it's not in the right place. But if you go down here to the left side where it says legislative notebook, that's where it is. We're trying to fix the hiccup so it goes on our regular place. So click there. And come on. Well, now it's not opening. Well, I guess there's another hiccup. Here we go. Let me go here.
I'm going to check it on my end, Kathy.
Try it on yours. Pages.
You might have too many things open.
Sorry, I have to. Some of this we have to have the ARC of the US fixed on our page, so it was a little bit tricky. Okay, hold on.
The link that should sent out last night worked, Kathy.
It worked last night. I'm wondering if they're working on it like right now. Because when I did it last night, it worked as well. Okay, view page. Okay, let's go here. I think I can do it this way. Okay, do you see this page that says notebook?
We do.
Yes.
Okay. Okay, good. It's there. So you'll see there's our regular stuff. This page is kind of the front page of the notebook. You'll see all our issue papers are here. If you drop down, they're kind of divided into 3 sections, and each of these is an issue page with the organizations that's the lead on it. And then if you go down here below, this is really the heart of it. There's more resources where it says the data to support IDD advocacy. And then there's organizational priorities. So then you can go there. Well, I'll go through each of them. And then reports to legislator, advocacy days, and then DD 101. So let's go to the data to support IDD. So here is here's the page. You're going to find the link to the entire slideshow that you'll see later on today. All the slides, and then you'll be able to pull out individual pages as you like. So each of those slides you can pull out. So if you just need one of, it's like, I need the data on that one page, you can go there and you should be able to, like, this one is the DD snapshot, and it'll open right up to that particular slide. So you can download them individually. I'm going to go back a page. Hopefully you're still seeing things. So each of those slides is there. There's also, this is really important, additional data down below. Some of those slides have some data. These are a little more intense data with specific things like a whole bunch of data around the DDCS caseload. There's information about the RHCs, waivers, SOLAs, etc., and where people live, that you can go. If you're a data nerd, that's where you want to go and take a look. And you will be able to dig a little deeper into those things and download that information as well. Also, I'll go back a page. So, organizational priorities. This is a link to organizations that are part of CAC, disability organizations, human service organizations, ed organizations, and you can see what their priorities are this next year. Legislative priorities. And then there's a link to our advocacy days. And you can already register for advocacy days for 2026. And let's see, the IDD 101 is also kind of a cleaner version of the slideshow for today. If you want to just go and share this information with a legislator and want to educate them kind of on the basics of IDD, that is where it is. And then you can also find where if you don't know who your legislators are, you can go there. And there's also a link to last year's notebook. Sometimes people want to go back and compare data from last year and find other things that were there. So, okay, that is the quick tour. I'll stop
Thanks,
sharing
Kathy.
now.
That's super helpful. So again, everybody take a minute to find that. It's working. I checked it separately. I think Kathy might just have so many things open. It doesn't want to help. Doesn't want to do it from your computer. Okay, so you've got the tour of the notebook. We are going to take just a minute for Emily Rogers to go over the Developmental Disability Council's state plan and the survey that was conducted to form that. And I'll let Emily explain what that is.
I'll share my screen here, Emily, and tell me when you want to switch slides, okay?
Sure, no problem.
This is the notebook that we see, Kath.
Yeah.
Okay.
Okay, hold on. That's the link to the notebook. Okay.
Okay.
There you go, Emily.
Awesome. So each 5 years, the council has a really important work to do, which is to create our 5-year state plan. And part of the 5-year state plan is a survey that we try to get out to as many people that are connected to our community as possible. And this past survey cycle, it was really exciting because we got 1,100 people from communities across Washington to fill out our survey. I think the last time we did it, it was about 800. So it was definitely an increase, which was exciting and great to see as we're continuing to get further and further out into our local communities all across Washington State. And there is a plain language summary, which is really great if you don't want to get into all of the details, and that can be found at that QR code there in the corner. It is really awesome to get feedback from so many people because it really informs our 5-year state plan and how we want to move forward and what kinds of supports we can give to our community through the next 5 years. So, next slide. So this slide shows you a bit about who responded, and you'll see that mostly it was family members who responded, and then next there were professionals, and then people with IDD. And as usual, I'm always hoping for more people with developmental disabilities to respond, but we continue to get more and more, and so that's good. Um, and and again, we had 1,100 responders this go round, which was great. Most folks come from urban or rural settings, and you'll see down there with the circles the number of folks who are in urban settings, which is like cities or more populated areas, and then the rural folks are more out in the country or less populated areas. Next slide. So what mattered most to the respondents for the next 5 years? And this is an interesting graph. You'll see improving existing services, 24.3%. Had that as one of the things to consider. Housing, 25.4%. Access to services, 26%. And these are essential for everyday lives and for folks who live in our communities and try to get all of their things done. And so this is what we will focus on in terms of how we think about our funding and where our funding needs to go in our communities to make sure that we're preserving access to services, we're improving existing services, we're looking at housing, we're thinking about employment and accessibility in terms of information. And so this is really key for us to keep in mind as we move forward. Next slide. And so the biggest barriers that people are seeing within their communities are lack of affordable and accessible housing, 19.8%, not knowing what resources are available, 26%, not enough money, 18.8%, not enough support, 18.8%, and long wait lists, 16.6%. So essentially, all of these things are pretty close to similar numbers, except maybe the not knowing what resources are available. And so, again, these are the barriers that we will try to tackle in the next 5 years, and that our council is responsible for creating our 5-year state plan and really taking a look at how we can look at these things and make some different proposals out into the community so that we can tackle these things. So we're excited to have such a active community participation. And is there another slide, Kathy? I don't remember.
Yes, one more.
Okay. And so one of the survey respondents said everyone should be able to get the help they need no matter where they live. And I think this is a key idea that we all can get behind. We want our communities to be strong and to be responsive to folks with developmental disabilities, and that is what we're trying to do through the survey and our 5-year state plan. Thank you so much.
Thanks, Emily. That was great. We are moving into this legislative session with Washington State already experiencing its own severe budget challenges. These budget challenges were going on before the pandemic. They had an interesting flavor during the pandemic, and as the federal support funds started to fade away, Washington was again faced with some very severe and significant fiscal challenges. In addition to that, we all know that H.R. 1 passed at the federal level, and that is posing some historically significant cuts to Medicaid that the states will now have to grapple with. So going into our legislative session, we know that we're going to be talking a lot about protecting developmental disability services and making sure that our community remains whole while we work this out at the federal and state level. So Kathy is going to talk a little bit now about what we're expecting this session.
Yeah, what we are anticipating. So, just as Stacy said, we've got a lot of things happening at the federal level. We're expecting the fallout from the federal Medicaid cuts and changes that will impact. We're concerned, the SNAP cuts that happened at the federal level sends a lot of pressure down to the states. That we know that they're trying to shut the Department of Education down, and that also is going to impact our state. There's threats to Section 8 housing and, HUD program and how it could be implemented and impact to our folks. There's threats to our, developmental disability infrastructure, although it's holding right now. But, we worry about things like our Disability Rights Washington and our DD councils. And although they're holding strong right now, but we worry that there might be threats to cuts to some of those programs. And we hear, potential threats to Social Security. Nothing clear, but, those are all things that we're worried about and how that plays out for people with IDD. And the biggest thing is that a lot of those cuts, especially the SNAP and Medicaid things, pushes down the cost of things to the states. And it also pushes the decision-making down to the states. They've got to figure out how they're going to implement those cuts. How the rules around it. SNAP particularly used to be paid for 100% by the federal government. Going forward, I think it's 90%. So that's a big hole. That's 10%. And the state's got to figure out, what are we going to do? Are we going to try to fill that hole? Or are we going to, just pass that cut along? It's like kind of a mean thing. It's like, we're going to make you decide how you're going to do it, right? And how they're going to implement it. And the same for Medicaid, they know there's going to be less money. How is that going to look? Where are they going to make those cuts? And although, there's been the home and community-based services, which is what IDD programs mostly are paid for by, although those were not directly cut in the Big Beautiful Bill, they still could be indirectly cut because they've still got to make the decisions about how do we make our budget work. So this is what legislators are facing. So first of all, inflation continues to rise, and we know how it hits in our personal budgets, right? That we're paying more for groceries, we're paying more for stuff. Well, that also means the state is paying more for things. So it impacts them as well. The other bad thing is revenue is down. That means that they're not pulling in as much tax money as they were anticipating. It wasn't quite as bad. I heard recently that it wasn't quite as bad as it could have been, but we still don't know how that's all going to look. So, their income is down, costs are up. They've got to decide, are they going to backfill SNAP and these other things that are coming from the federal government and the loss of federal Medicaid funding. And also our caseloads continue to grow. So there's more people. So it's like your family's growing, the cost to raise your family is more, and your income is going down. So that's the kind of thing that legislators are facing this session. And this is the dilemma, there's a big hole is the bottom line. There's a big hole and they got to figure out how to fill it. And, how deep is it? Well, I don't know. It depends on who you talk to, right? If you talk to different legislators and different people, they may say a different number. But I haven't heard one legislator say from either side say that it's looking good, right? That we could figure it out. They're all going that this is going to be an extremely difficult session. So, when they talk about billions of dollars, okay, this is just my little game to play with you guys. So how much is $1 billion? We think about $1 billion. So I did some calculations. So if a person works 40 hours a week at Washington minimum wage, which is $17.13 in 2026, that will be next year, how long would it take them to reach $1 million? So you want to guess? So it would take about 28 years and 7 months to make $1 million at minimum wage. Okay, that would be working every day. That doesn't, your bills, etc. Okay. So how much is $1 billion comparison? So it would take 28,000 years to make $1 billion if you were making 40 hours a week at minimum wage. That's just kind of like, okay, I could kind of measure, in my lifetime, you could think about $1 million, $1 billion, 28,000. Okay. And just for fun, how many years would it take to make $1 trillion? Because that's a word. 28 million years. So that's just to blow your mind a little bit and think about it a little bit. And, so they're talking about several $billion in the budget hole, right? That's how much, that's a lot of money. And it's just to try to get your brain about how much that is and what the impact is. So, and legislators only have two ways to deal with the budget. They either have to make cuts or they have to raise taxes. And guess what? Neither of those things is popular. So it will not be a popular session. These are the things that we're most concerned about, that we don't, and this is from a historical perspective. These are things we saw happen during the recession in 2008, 2009, where they manipulated the eligibility. They narrowed eligibility for DD. So we don't want to see that happening. They also changed the algorithm for personal care, the care assessment back when, to narrow it so people got less hours. That's something we don't want to see. They started to mess with waiver services. We want to make sure that all those services stay intact. And we want to make sure that our provider rates stay intact or sustained, because when provider rates go down, then access to service drops. It will be more difficult. It's going to be more difficult to find providers, and more difficult to, get the things that we need if they lower the provider rates. We already have a workforce problem. We don't need to make it worse. So those are the big things that we're thinking about. And kind of the messaging we're talking about this session is protect disability services, protect community living, and protect our disability rights. I think those are all the things, and that's kind of the themes that we're going to be hopefully be unified and staying together that we need for this next session. I think that was all.
Thanks, Kathy. That was a great overview. I heard a TED Talk not too long ago that said, you know, it's great to be resilient, but when you're the person being resilient, it doesn't feel very good. And our community feels like it's constantly being described as resilient. And I think that it's difficult for us to go into yet another session and worry about stagnating caseloads and stagnated rates, which are almost as bad as experiencing a cut, because we know there are so many people that are in need as it is now. So we'll keep working on how we come together as a community. Certainly your individual stories matter the most, but as a collective, we also have some power. And our state has a community advocacy coalition, which is a group of nonprofits that have come together to try to strengthen having a unified voice. And the Community Advocacy Coalition, thanks to the Developmental Disabilities Council over the last couple of years, has gone through some strategic planning and put together a survey last year and this year to really tap into what that membership thinks is an important priority, and to try to spend this next legislative session communicating those priorities to legislators as a collective of over 50 nonprofit organizations that support people with intellectual and developmental disabilities, including self-advocate organizations that have come together. So Ramona is going to now share with you a little bit about this last year's survey and what priorities floated to the top. Ramona, if you feel ready to do that.
Yes, hi everyone. My name is Ramona Hattendorf. I'm the Director of Public Policy and Civic Engagement at the ARC at King County, and I am, along with Eric Mathis, one of the outgoing co-chairs of the Community Advocacy Coalition. And before I jump into, I just want to welcome and let everyone know we do have two wonderful new incoming co-chairs, and those are Ayan Elmi and Noah Sidel. And in case you don't know, historically, we've always tried to get co-chairs that come in with a parent perspective and co-chairs that come in with a self-advocate perspective. And I'm really happy to say that we're going to continue that tradition this next year with Noah and Ayan. And we also have some other really good experiences coming in with more of a multicultural sense from Ayan. So I think it's going to be a great next year for the coalition. As far as backing up now into our priorities, so everything that Kathy and Stacy just went over, we were going over those too. We have this year we took a deep dive approach. So we had discussion. We had some proposals. We had time to think about those proposals. We did an initial survey. We did deep dive discussions based on what that survey told us of where we had some disagreement, or maybe not quite. We had questions, not necessarily good disagreement, but we wanted to learn more together as a group. And then we took a final survey. So we confirmed the issues that we could support as a coalition. And then we also confirmed the priorities that we're putting on those. And like other coalitions you're going to be finding this next year, our top two, and I'm going to go ahead and put those into the chat here. Our top two are no cuts to services. And we also want to see a plan implemented that will build up community supports while phasing out the IDD institutions, also known as residential habilitation centers. We aren't interested in a lot more studies. We have years of studies and reports. What we really want to see is a concrete plan to invest in those community services strategically so people can get what they need. In tracking back to our protecting existing services, I will also put into the chat. Oh, sorry, I forgot to send the chat. There you go. I'm going to put in a summary of what this is. You can follow along. Um, but with developmental disabilities and disability in general, I mean, there are services specific to the disability. There are healthcare services, but it's wider. You need to be wrapped in certain supports. And so we also are considering access to safe, affordable, and accessible housing, reliable access to food and healthcare, as well as the tailored supports we need to live in the community. And these include different types of residential support, personal care, support employment and community inclusion services, respite, life skills, and other essential services. If you start pulling out one of these, it can all collapse. We really need all of those. And as a coalition, we're going to be working to try to make sure that legislators understand that you can't cut back on one and think everything's going to be okay, because it's really combined. Our second top priority was implementing that plan. There's not one blueprint plan out there, but we do have many, many years of reports and studies. 5 years ago, maybe a little bit longer, we had the Ruckelhaus plan. But we've gone through this exercise. We know where the demands are, and we really want to see those investments in community services. And again, that includes things that we're looking to protect this year, including housing, healthcare, food, as well as the specialized services that many in our community are working on. We also have additional priorities that we identified. And in our coalition, we identify these are issues that our members have all brought forward. So that's like a top criteria. It has to be something that we're working on internally. It has the support of everybody in the coalition. We went with a consensus model. Some people can't take positions on certain things, and that was okay. But we went through a process to ensure that there was zero opposition. So no active opposition to any of these. And the issues were, our number 3 was establishing progressive revenue for community services. We are in a pinch, and I can go into that more later when we go into the individual ones. We also had protect immigrant and refugee families with intellectual and developmental disabilities from discrimination. That one is a very real concern of many of our families in our community right now. Protect and preserve supported living funding, and isolation and reduce restraint of students. Eliminate the community protection program. That's one of it's a services under the core waiver. Reduce red tape to strengthen services for people with IDD. Address systemic anti-Black discrimination. We do see it reflected in who gets services and the types of services and how they experience community or lack of it. Preserve and make available IDD historical records. Update requirements to allow individuals with 2 or more years of direct care experience to qualify as IDD life skill coaches. You'll learn more about that one. It's a mouthful, but basically we want to make sure that people who have time and experience working directly with people with IDD, that they can also be eligible for providing skill coaching. And then finally, make yearly training requirements for relative providers voluntary and paid. And these are also known as family caregivers. And this is a caregiver where somebody is only caring for a specific person in that family. So perhaps a grandmother for a grandchild, an aunt for a niece, something like that. And we just want to make sure that the training they get is really applicable to what that person needs, and it doesn't become an undue burden. But again, we'll be going a little bit more into some of the different issue areas later in the agenda. But those are the ones that we have come up with. And I will put a link in the chat if you would like to open up and read a little bit more about what some of these issues are. And the individual people who brought them forward will be speaking to these issues later. And then I also just want to take a moment to say, welcome, Noah, and welcome, Nyan. I'm really glad that you're here, and I'm really glad that you've stepped up. Back to you, Kathy.
Thanks, Ramona. This is Stacy, and as outgoing co-chair Ramona Hattendorf, we want to make sure that we really thank you. I can't imagine there's not going to be a million hearts and applauses in this. You have been co-chair during a time along with Eric Mathis. Thank you, Eric, as exiting co-chair as well. That's a little historical. We did a lot of intense strategic planning, and you did an amazing job leading the group through that. So we just want to make sure and express that to you today.
You're welcome.
Okay, we're going to get started on some of the issues that people and organizations are bringing forward to present to the legislature for some debates and influence. And we're going to make sure that we fully educate you as much as we can on the kinds of things that might be coming up. As I mentioned, though, we have a number of very important persons coming by to say hello. Some legislators are going to pop in and out as they can. Some will stay and listen for periods of time. And right now, we have one state legislator that we'd like to introduce and give her just a moment to say hi to everybody, and that is Representative Stephanie Barnard from the 8th Legislative District. Welcome, Representative Barnard.
Thank you, Stacy, and thank you everyone for having me. It's such a pleasure to be here with you and to hear about your strategic planning and how that's going. And I appreciate all the hard work that goes into strategic plans. That's a difficult process. So props to you and the team for doing an excellent job. I just wanted everyone on the call to know how committed I am to protecting DD infrastructure, services, disability rights, all of those essential services that what we could potentially lose. That's a huge concern to me. I know that, it was brought up earlier about, SNAP and the concerns with Medicaid. And I just want you to know that I am a huge advocate to help out in this way. One thing that I did want to bring up, and I hope, Stacy, just stop me if you don't want me to talk about this, but I just wanted to tell a personal story about records preservation. My mother-in-law, she's now my ex-mother-in-law. One of the things that I did for her, this was back in the early 2000s, was, her grandmother, she never knew her grandmother. She had some disabilities and was institutionalized for 43 years of her life. And she never knew where her grandma was buried. She never met her. She never had a chance to get to know her. And so one of the things I did, this was before I was ever a legislator, but one of the things I did and wanted to do for my mother-in-law was to find out more about her grandma that she never got to meet. So I started to do a little research. And one of the things I did was I reached out to the Secretary of State's office and said, hey, can I get some records? This woman I had her name, I had her birthday, and I had the approval of next of kin, which was my mother-in-law. And we were able to, and this is the neatest gift that I have ever given anyone for a Christmas present. I was thrilled to be able to hand my mother-in-law over 200 pages of records of the 43 years that her grandmother spent in an institution. And it allowed her to get to know her grandmother in a way that you would never have that opportunity otherwise. And it was, I can't even tell you, she cried and cried, and there was, tears shed. And as we both went through those pages together, we were able to find out, why she died. We were able to find out a little bit about her personality and some of the things that she had struggled with. And it was incredible. We never were able to find out where she's buried, but it gave my mother-in-law the closure that she needed on this part of her life, and the value of those records. It's just can't put a price on that, so Kathy and Stacy, I just appreciate all the work that you've done, and we really need keep that moratorium for getting rid of the records. We need to keep that in place. It's so important to me, and I have a personal experience with that. So thanks for allowing me to share that very personal experience with you about my my mother-in-law's grandmother. So I just want you to know again how grateful I am to all the work that you're doing. We need to definitely go into defense mode and continue to protect all services, infrastructure, and disability rights from any of the fallout from what's happening currently at the federal level, and want to make sure that our DD community isn't going to lose any more than they already have. So I'm committed to that, and just wanted to say thanks again.
Thank you. 8th District, you are awesome.
That was Sharon Adolson for you, Representative Barnard. One of your constituents.
Thank you.
And Representative Barnard, we just want to thank you again so much for being present today and being here. It's a lot to learn and digest and understand, and you've been a great champion of ours over the last few years in the time that you've been in the state legislature, and we're just so grateful for that. Thank you so much. And that was a very poignant, touching story. Just again, the stories matter so much in our world. And for the rest of you, you know, we have a bill that would preserve records that are currently at Lakeland Village RHC, and you're going to learn a little bit more about that in about 15 minutes or so. So I just want to thanks for that nice intro, Representative Barnard. Nice little segue that'll be coming here.
Let me know if there's anything I can do to help. I'm here for you, and I know my heart is in this. So thanks again.
Thank you so much.
All right.
Okay, we are going to move on now to a bill that was here last legislative session. Noah Seidel, if you're ready to queue up and talk a little bit about the bill that would eliminate the community protection program and what that means, we're ready for you.
Hi. Hello, everyone. My name is Noah Seidel. Just like an image description, I'm a white 35-year-old male wearing a purple sweatshirt today, and I have black hair and black glasses on. And I'm with the Office of Developmental Disability Ombuds, and I'm going to talk about the Community Protection Repeal Bill. And this is a bill that was in the legislatures last year, 1390. This is agency requested legislation, which means that this legislation is being proposed by DSHS and has gone through that process. And this bill would eliminate the Community Protection Program. And I'm going to talk a little bit today about why the Office of Developmental Disability Ombuds supports this and some of our work around community protection. So our office on our website, and I can put into the chat when I'm finished, has a report called No Way Out. And it's an introduction to the Community Protection Program. And this is one of the DDCS waivers. So this is a waiver that people are on. And we have 3 kind of issues that we lay out why we think that this waiver should be eliminated. And our concerns are that people are referred to the program at a young age before they have an age of 18. So you have to be 18 to be on this waiver. But we saw that people were referred to this waiver around that age before they had access to other supports or services. Individuals must be on the community protection waiver or risk losing access to other waiver services. And there's a low graduation rate for people who are in the community protection program. So just a little bit of background about the community protection program is it was created as a way for people who might need extra supports to be safe in the community for themselves and others. But in our review of the program, it has gotten larger, and we're seeing that there's people who were put onto the community protection waiver who might now have the supports they need to not be on it, or maybe should not have been put on in the first place. And this is a waiver where people have 24-hour supervision. We saw that people's rights were being taken away. Some people are not allowed to use a phone or go on the internet, couldn't see pictures of their family members. So there's these restrictions that led us to having some concerns about the program. So we support the legislation that would eliminate the community protection program and make sure that people can be put on other waivers and get the level of support that they need through the other waiver services by creating person-centered plans, person-centered transitions to the other waivers, and ensure that the developmental disability community services work with providers and the individuals and others to help them get the supports they need to live in the community and receive their supports through those other waivers. So we will be tracking this legislation and I don't know if we're taking questions today or that is kind of the overview, and I can my information is on the one pager if people do want to connect with our office.
Thanks, Noah. That was great. And I think a lot of us are familiar with this legislation. It's been getting finished and finalized for a couple of sessions now. I don't see any questions in the chat or in the Q&A, so I think you're good to go. And anybody that needs to reach out to Noah, he can be reached at the Developmental Disabilities Ombuds office. We appreciate you reviewing that for us. And Noah, I understand that there's a pretty good chance that last legislative session, it was just really a matter of running out of time, and that this will be introduced first thing in session and has a good chance of passing. Is that right?
Yes, so this legislation, it passed the House last year. It had some amendments that would kind of make it so that people got the supports and a transition plan in place. And it did pass the House. It passed out of its Senate committee and the Senate Appropriations Committee. And it was on the Senate calendar the last day of cutoff. And we were told that it would maybe get a vote, it could get a vote, but it did sound like it ran out of time and a timing issue. And so hopefully, it can go through that process again. And does not have a fiscal note. So hopefully it won't have to go through the fiscal committees again this year.
Thank you. Thanks for that update. Appreciate it, Noah. All right, next up on the docket is either Melissa Johnson or Scott Livengood or both to talk to us a little bit about the Community Residential Services Association and what legislative priorities they're going to be looking at this legislative session. Melissa or Scott, take it away.
Thank you, Stacy. I think it's going to be tag team because I have a 10:30 meeting I have to jump to. So I'm going to start with our first preserve and protect budget or agenda item, and then Scott's going to talk about our bill. So Kathy gave a great overview of the budget situation that the state is facing. And when we talk about billions of dollars, legislators are telling us it could be anywhere from $3 to $6 billion over the next 3 years. So there's a huge budget hole, as Kathy said, that the legislature will be facing. And we know there are going to be cuts. And we know for supported living, last time we were in this type of budget situation back in the Great Recession, supported living rates were cut. So we come into this session not asking for a rate increase that we typically do, but asking the legislature to preserve and protect supported living funding rates. Because again, we know if history repeats itself, we know that this could be on the table as far as cuts for supported living to balance the budget. And we know that the rate increases that we've been having over the last many years have done what they were intended to do. They have raised our direct support professional wages so that our turnover rates are decreasing from a high of 70% during COVID to now 35 to 40%, which is still high, but it's lower than what we've had in the past. And so we know that those rate increases are getting us in the right direction. In the last couple of years, they haven't kept up with the cost of living. So we are starting to kind of lose some ground there. But it's been so important for us to have at least even a small rate increase to try to keep up with inflation. So we are very concerned since we are a large part of the DDA budget. We serve over 4,600 clients now. We know that that's a place where legislators may look to. And Governor Ferguson, he's in the middle of putting the final touches on his budget. We'll see that in a couple of weeks. And so I think that will be the first template that legislators will have around cuts. So we'll be watching that. We've been working with OFM to try to stave off any cuts in the governor's budget as well. So that's kind of our top line message to lawmakers that we've been telling them over, the last 5 to 6 months. So that's our top budget priority. Scott, do you have anything to add on about that one?
I think the only thing that I would add is that, we've been making a big push, within CAC, CRSA, others about trying to serve more people in the community, and like the rate investments have made a huge difference. We were nearing 4,300 people served during COVID. Numbers were decreasing. In the last report I just got last week, we have now hit 4,700 served in support living. So it's making a big difference. More people are being able to move out. Referrals are being accepted. So investments work, and we really worry that if there are any reductions, cuts, we'll see those numbers go back down. So as far as legislation, we looked to see what we did last time. We were facing something like this, 2009-10, and we looked to efficiencies. So in looking at efficiencies, what can we do to maybe create some efficiencies within supported living and DSHS? Over the past several years, those that provide this service have noticed an increased number of QA visits, evaluations, investigations that are conducted within supported living has just increased exponentially. And at the same time, we noticed the number of QA positions within DDCS increased significantly as well. And we are definitely an open book, and we take part in all these, but we were noticing a lot of duplication of efforts. Things that we provided once to RCS were being asked again by DDCS, were being asked again by another party, and often within just a short period of time. So we started asking DDCS to provide us with a list of all of the QA investigation certifications that were done in supported living. We finally got that list about 4 or 5 months ago, and it's 25 long. And there are some that are mandated by CMS, Social Security, et cetera, but over 70% were created by DSHS. They were internal requirements that were imposed. So we started looking at a bill. We have a draft. We have sponsors in the House and Senate, Zahn and Barnard, who was just on, our sponsors in the House, and in the Senate we have Gildon. And so what it does is it says that the department needs to adopt rules streamlining these QA visits and investigations so that they do not have duplication, that they limit the number that are done in certain areas around client finances, client service plans, federal compliance reviews, community integration, provider finances, general quality assurance. Because when we compiled that list of 25, there are 5 done around client service plans, 7 around client finances, 6 general QA, 6 incident report, and 8 evaluations and investigations. So the bill calls for data sharing across DSHS so that they can share information, so we don't have to have someone in our program for a week or 2 sometimes, providing the same information, often within just a period of weeks. And then the last part is also around background checks. For those of us that have a number of contracts within DDCS, we are being required to do a background check for every single contract. Again, often within the same month or week for the same employee over and over again. So we're asking for data sharing to be done across the contracts so that the same employee does not go through 3, 4, for me, 7 within just 1 year. So that's what our legislation calls for. And again, we do have sponsors in both the House and Senate.
Thank you, Scott. That was a great overview.
Yeah.
I don't see any question. Oh, wait, let's see. There's a Q&A. Let's see if it has to do with here. There. Oh, sorry. That was about a prior issue.
Great.
So it sounds like you're on track for this in terms of rates and this bill that'll consolidate the kinds of requirements that you have to go through. And we appreciate you bringing that to everybody's attention.
Thank you.
Okay, we have one more issue to highlight before we take a quick break. And we are also keeping an eye out for Representative Daria Farvar, who will join us sometime between now and the break, we think. So we'll just move on to our next speaker and topic. This one is about the preservation of records. So you all heard Representative Barnard mention the value of learning from our history. And we are fortunate enough to have had Senate Bill 6125 pass a couple of years ago that preserved some very unique records that go as far back as the 1890s at one of our state RHCs called Lakeland Village in Medical Lake. That is the focus of this particular legislation, but of course we know there's history around each of the RHCs. And it's important that we learn from that history. Today, we brought you a very unique guest, Dr. Joanne Wowiak, who was involved in some of the legislative requirements around preserving those historical records. And she's going to explain a little bit in more detail what the 2 reports were that came from that legislation and why this matters, why each of us should care about this history. So it's my pleasure to introduce Dr. Joanne Wowiak from the University of Washington.
This is Joanne speaking. Thank you so much, Stacy, and everybody for having me today. I popped my slides into the chat as an access copy, and then I'm going to do a share here as well. So I'm going to do that now. Get all that working, and there we go. So let's, I just wanted to do a little bit of an update on the Lakeland Village Records Project. My name's Joanne. I am in the Disability Studies program, faculty member at the University of Washington. I just want to make a quick content note that one of my slides has some content you may be aware of, just to take care. I won't go into this in detail, but some of the historical ableist language and a mention of eugenics and sterilization there. I also wanted to just preface this short update a little bit with a note that this history of Lakeland Village, of course, encompasses the lives of people with intellectual and developmental disabilities, as well as other groups of Washingtonians. That becomes very, very clear when you get a chance to sample these records. And I think that's always worth mentioning and highlighting. There's so much potential for coalition building between marginalized communities around race and sex and gender and immigration status, and other disabilities who are represented in these records also. And just remembering that history shows us that our lives are always intersectional, right? I think that that really accentuates the work that so many of you, all of you, do here. So I'm going to flip to my next slide. What was this Senate Bill 6125 project, the Lakeland Village Historical Preservation, for preserving the records and artifacts regarding the historical treatment of people with intellectual and developmental disabilities in Washington State. These were a set of documents that were discovered in a 3rd floor storage area at Lakeland Village RHC. They were administrative. There were lots of photographs and tons of what are called resident case records, what I'll refer to here as RCRs. These resident case records comprise most of the collection. The total number of boxes that were found was about 2,500. Most of them, about 80%, or sorry, 1,800 boxes, are RCRs. These help to trace the lives of 6,200 approximately residents of Lakeland Village, dating from as far back as 1892 to a cutoff point we kind of set here for some of what we're talking about of 1975. And that consists of 130 of the boxes. And those RCRs are now designated non-archival, so they are eligible to be destroyed by the state unless we take action. And Representative Barnard's narrative was really powerful and really exemplary here, right? Of some of the folks who obviously have interests in these historical materials. So who was a part of this project? DSHS, of course, manages these records. We also worked with state archives who jumped in there and on short notice completed a remarkable inventory of these 2,500 boxes, and they were the primary authors of the report, the preservation plan for these. And then our group is the UW Institute on Human Development and Disability, IHDD. We included faculty and students who specialize in archives from the Information School and in history from Disability Studies, including myself and a graduate RA research assistant that's been working with me. We did a sample of some of these boxes. We tried to evaluate the historical value of the records and artifacts and photos. We made recommendations about how to appraise, how to assess what has historical value and for whom, and what public access to these should look like. And we ended up in the end writing what we call a companion report. We wanted to flesh out our perspective and our recommendations a little bit more fully than we had time for when we were working directly with DSHS and the archives on the primary report, the main report. So there are two reports, and we can share those also as we're going along here. And if Stacy or anybody does want to share, I don't have them.
I'm happy to put those reports in the chat. I'll work on them.
Yeah, thank you. And I flipped around. Sorry about that. Previous. Very, very, very briefly, my research assistant and I had the opportunity to start to do a history of Lakeland Village, and that will be part of the finding aids for this collection that goes into the archives. It did start in the 1890s in Vancouver as the quote-unquote School for Defective Youth, which did include students with a number of different disabilities. The state institute, it was sort of separated out as the state institution for the so-called feeble-minded, 1905. There was a history of eugenics and advocating for sterilization of folks with disabilities as early as the 1910s. I'm a historian. That's kind of my time period in my history, the history of eugenics. The Medical Lake facility opened in 1917. It was literally built by the residents, by the male residents. It was called the State Custodial School at that point, and got its own campus, expanded into segregated residential cottages and vocational training. The second custodial school opened in 1937 in Buckley that was the moment when what became the ARC was founded, right? And so that history connects to Lakeland Village as well. Renamed Lakeland Village in 1947, and then we move into sort of the eras of deinstitutionalization, community living and services here. Zach, I see your comment. The School for Defective Youth sounds like a great name for a band, to be honest. Thank you. Good to see you, Zach. Good to see everybody. Okay, I'm going to flip to a little bit about, so what was that? What were the findings? What are the outcomes? What are the recommendations of this roughly year-long project that we engaged in to start to evaluate these records and their historical and educational value? The recommendations we agreed upon with archives and DSHS, these are in the main report in particular. There are many, many administrative records, about 250 boxes. These will be permanently archived in Olympia. That is the retention policy. We will hopefully, the UW IHDD team will be part of creating the finding aids so that public and researchers and families can have some tools for navigating this growing collection And then we're also talking about digitizing a small collection of the photographs that were found at Lakeland Village and publishing that online on the archive site. And administrative documents are about the establishment, development, and history of the facility of Lakeland Village itself. The records that are now designated non-archival will be retained by DSHS, and there is an approved records schedule, a retention period. Different records are held for different amounts of time. The resident case records, FYI, are held for 50 years after the discharge or the passing away of the individual. We'll have a 50-year period. Hence, we've got this kind of 1975 cutoff point that we've been utilizing so far. And then we've also generally agreed here that the state should explore making an amendment to an RCW that would automatically phase out the protections of confidential information in records that are held by the archives, and to phase that out after 75 years. So that records that would be considered historical and would be open more broadly for public accessibility and use. Currently, to access this material, you generally have to be a researcher who can get some sort of approval, such as an institutional review board, if you're like me, a privileged person at a university who can access that sort of approval method. So we want to make these records more open and call them historical. And there is precedent for that. We can find you a link to a bill that's just passed in Massachusetts along those lines. New York State is also doing similar work. So that these materials from institutions, disability institutions, can be more available to the public. Where we disagreed with archives and DSHS, we as the UW IHDD team, myself and my faculty and student colleagues, is what to do with the resident case records. They've met their retention period, they're slated to be destroyed. And as I say, this tracks 6,200 people who were residents from this period, 1892 to 1975. These are a unbelievably, as Representative Barnard just spoke to, rich source of information. It's really, really powerful. It's really, really important to family genealogists, descendants, potentially to a wide scope of researchers, and of course, the wider public and community advocacy and activists should know about and have information and access to this material. So I won't go through the entire scope. It's incredibly gripping. We were able to sample a lot of boxes just to get an idea, but we weren't doing research on this. That wasn't the scope of our project. Just to get an idea of the types of information that was being collected about folks and learning a little bit about their day-to-day lives, very honestly. It's really, really very impactful information. I'm going to flip to the next slide. I think that I don't want to go through everything about, and in our IHDD report, we kind of laid out, well, what are the differences in the missions and the values of the archives as opposed to the IHDD team? I don't want to go through it in detail here, but I think that the important points are kind of here in the middle on the state archive side. That archives argues, of course, it's their mission to be impartial, as they say it. We kind of put it in scare quotes there. And they did have some verbiage about being a bit concerned about creating precedents that could allow what they called external parties to dictate archival designations. They do consider themselves to be the experts on what is of enduring historical value and should go into the archives. And on the UW IDHDD side, where we're much more, I think, active in thinking about stakeholder participation, thinking about community decision-making, informed consent, the ways that archives and archival practices can be very inequitable, right? It is a truism that most of the voices of marginalized communities and folks are absent, silenced, or hidden in archives because that has been the practices of archivists and archival keeping. And there are new practices and new values, and we are advocating for those more so. So what specifically are we advocating for and recommending here?
Oh, Joanne, will you switch to the next slide down? You're still on the brief history.
Am I? Oh my gosh, did I stop sharing along the line?
No, we still see you've got it. It's just that you've got slide 4 up instead of slide 5. You just click and scroll maybe, because I think you're in control of the PowerPoint right now.
I am in control of the PowerPoint, but you are right. Let me do a stop share because I think I'm in the wrong place. I didn't see my little green square. Do it again. My bad.
There you go.
Okay, here we are in the recommendations. Thank you,
Thank you.
Stacey. Oh my gosh.
No, it's all good.
You'd think I hadn't been teaching this way for 5 years now. Thanks everybody for bearing
You're
with
doing
me.
great.
So of course we're, as we already heard, we're asking for a temporary moratorium on destruction of records, the records that are in the scope, right? Those 2,500 boxes that were discovered. And I think that discussions will start about whether those should be transferred to the State Record Center, whether they can actually stay at Lakeland Village. I think that some estimates, budget estimates have been circulating on that. It seems like there's space at Lakeland Village for them to remain there if that's possible. They are secure, they're in their boxes. Everything should be good to keep them there as far as we could tell from our few visits. And then we're suggesting stakeholder roundtables, right? Residents, descendants, family members, disability community organizations, the local communities, Medical Lake and Eastern Washington, researchers, educators, lawmakers, legal experts of various tilts should get at the table together, right? To actually do some decision making about what should happen with the RCRs. Who would be interested in these materials? How can you balance access to them with very rightful concerns about what is called, quote unquote, patient privacy or resident privacy? Some of these are medical records. They're sort of all considered to be medical records, which is interesting. And then we are, again, highlighting participatory and community-based practices in archival work. This, we think, is becoming best practice in the field as these archival values shift to take into account balancing privacy, access, and community needs and expectations. Okay, I'm going to flip. We also, I'll go less detail here, but we do think that the resident case records, if the stakeholder groups work through this and agree with it, that the RCRs could become archival, maybe should become archival. They do help us to document shifts in policy and rights movements that help us to understand more about Washington's history. There are precedents in other states that archive these types of individual level case records. And there is great research value to these, right? We ended up writing a lot in the appendices of the main report about who are the researchers, what is the type of work, what are other precedents of this type of individual level personal stories that are evident in these types of records. How does that get used by lots of history researchers and so on? And then we're also thinking about whether these resident case records should be offered back to the residents, to the individuals, to their families, to their descendants. So we'd like to consider offering them a choice of having them returned, whether they could be archived or whether they should be routinely destroyed. And then we're also we put forward a little bit of a budget for a limited targeted digitization of some of the records that seem especially significant or relevant to communities or at risk. Broadly, we're part of a bigger picture. We're part of a bigger movement across the nation. There's a lot of public interest in preserving history, learning more about history. I can direct you to the site for the Hogg Foundation for Mental Health. They've published this survey. There's about 500 adjacent types of projects that have been going on, including considering some of the policy issues around privacy and around stakeholder engagement that we're talking about here. And this is the conclusion of our companion report. There's differences in perspective and how we understand the importance of these Lakeland Village records, but let's take this as an opportunity to learn more about community perspectives and give a voice to everyone. We should use this preservation to learn from our past and change our future. And so we're urging the state legislature to partner with disability organizations to undertake this challenge of preserving this fantastically rich collection. I'll stop with that. Let me stop sharing and check if there's questions that have come up.
Thanks, Joanne. There were a couple of questions. One was about whether or not the records will be digitized. And I answered back that, well, we're waiting for funding to do that. We think that's incredibly important. Is Lakeland Village the only facility that preservation of records is being asked for? And I answered back, yes, right now, but our goal would be apply it to each of the others, including those that have already closed. So Interlake and Francis Haddon Morgan has a trove of records somewhere at DSHS, that would
At
be
DSHS,
go dig
yeah.
those out as well. And then former residents be invited for their input. And I noted that the strong recommendation from the UW team are to include residents, former residents, and their families in any of the decision making that's getting made going forward.
Karen had a question in the chat about how they can get more involved in this project.
This is Joanne. I think that is the question for all of us. Not at this moment, obviously. I've taken up beyond my allotted time, but I am happy to have folks start to reach out to me. And I'm obviously in conversation with Stacy and Kathy and Sean. I owe you an email from a long time ago. I think that we should start to work on thinking about how to conduct these roundtables. Yeah.
Thank you, Joanne. And I just keep going back to your words, how gripping and historically unique the value is of these records in revealing the voices that are historically hidden from this conversation. I noted in the report is an oral history that happened, but it was mostly the voices of people who worked at those facilities. It did not include those residents. So this is another gap that we're trying to fill in. And I can't thank you enough for your expertise. It's amazing. We are just a tiny bit behind. And so I'm going to thank you again for coming. And
thanks, everybody.
We're so grateful for your ongoing work in this, and more to come, everybody, to listen on this. Zach, you have a hand, a quick question?
No, meant to do a clapping instead.
Oh,
Sorry.
that's great. No worries. So thank you again. Before we take a quick break, I understand that Representative Daria Farvar has joined us. I thought I'd give her a moment, and then we'll take a short break after Representative Farvar has a minute to say hi to everybody.
Thank you, Stacy. Hi, everyone. Can you hear me okay?
Yeah.
Yeah.
Okay, excellent. It's great to be with you all here today. Thank you for the chance to say hello and give you a quick update on what we're working on. I'm sure you have heard from all of the fine folks, advocates, legislators, electeds alike earlier today about the sort of landscape that we are going into this session. We're going into another difficult session. Last year, we were facing about a $15 billion deficit. This year, we're looking at about a $5 billion deficit, and that's before the federal cuts come and impact us in Washington. And so I'm looking for ways to figure out, beyond just playing defense and making sure that DD services stay intact and that nobody loses services, because unfortunately that's the landscape that we're in right now. Also trying to find ways that we can have some wins. Maybe there'll be smaller wins this year. Maybe they won't be as grandiose as we had hoped in the past. But to keep the conversation moving forward and to continue to educate folks on DD issues. Last year, we saw truly just how much education was still needed with my colleagues about the DD community and the needs of the DD community. And that was especially the case when we were discussing the fate of Rainier RHC in particular. I am sure you all are still reflective of that moment as I am. It was a very, very difficult moment, and I am committed to trying to make sure that my colleagues better understand these issues, better understand and listen to the voices of the DD community going forward. And so this year I'm preparing 3 bills to try and do some more education and really build upon the narrative to make sure that folks understand just what self-advocates in particular need and want, and also what their experiences at the RHCs have been. And so thank you, Dr. Wowiak, for that great presentation. I was able to catch the end of it there, which was fantastic because I have been talking with Stacy, and I think she has been connecting me and Dr. Wowiak sort of behind the scenes there to figure out what we can do to exactly that, preserve those records at Lakeland Village. So we will have legislation this year related to that. I'm hopeful that it won't just be the basic standard sort of moratorium on destructing records, but that we can also address the 75-year retention period as well. We'll have to see as we get closer. And of course, so much of it will depend on fiscal notes. So we're having some of those conversations right now. Another sort of, I don't know that it's a small effort, but another bill that we're working on this year is also to just name things what they are. I don't know about you all, but I think I am going to have a meltdown if one more person called an RHCA school. It is so deeply offensive to call those places schools, and also just wildly inaccurate. We know that there are at most 20 school-aged people at the RHCs right now. That is, I think, reflective of a different time and a different way that the RHCs were used. And most of the people I talk to refer to it as an RHC. You talk to DSHS staff, they refer to it as an RHC. Talk to many of my colleagues, they refer to it as an RHC. School is extremely outdated and offensive. So we'll also be introducing legislation this year to try and do that for once and for all, because I don't know about y'all, but I am sick of it. And then the third thing that we are working on is really trying to shed more light on what is happening within our RHCs. A lot of the narrative last year was that there were a lot of folks that were concerned or scared that if we move folks out of the RHCs, that they will pass away or worse. I think a big part of the story that was missing was what's happening in our RHCs right now. Many of you know what's happening in our RHCs right now, and it is frankly horrific abuse and neglect that folks are experiencing, and people are dying in our RHCs right now. So we are going to be duplicating a statute that exists right now for the Department of Corrections that requires unexpected fatality reviews. So every time someone passes away unexpectedly, they will have to convene a group that will very likely include the DD ombuds to discuss it and to report on it, send that report out to the legislature and the public so that they can have that information and then figure out how to remedy it and prevent it from happening again. So 3 fairly simple bills that we're working on this year. And now that I've said that they're simple, I'm sure I've just jinxed them for the legislative gods out there. But bills that really help uplift the narrative, things that I think are possible, are feasible for this legislative session, and that will continue to keep DD voices at the center of our work. So thanks for giving me an opportunity to come say hello. It is always so good to be in this community, even virtually. We all are the community that invested in me and made this possible for me. And so I am committed to investing in you all and making sure that DD community is taken care of as well. With that said, I would love to stay and answer questions, but unfortunately I have to run into another meeting. So good to see you all, and I will sign off from here. Thanks.
Great. Thanks, Representative Farber. Let's all hear it for Representative Farber. She is a unique champion for us, and we're so grateful. Thank you for coming in.
Thank you.
All right. Super excited to welcome, as we return, Grace Wong, who is the governor's policy staff, a senior policy staff at the office of Governor Bob Ferguson. And she's been learning about our issues just steadfastly since she came on board. It's a lot to learn, but we're really excited to welcome her here and have her chat a little bit and share some information with us about this upcoming session. Welcome, Grace.
Hi, and thanks for having me. And yes, it's been a learning experience. For those of you who I haven't met, like Stacey said, I'm Grace Wong. And my role is as a senior policy advisor in the governor's office. And I work closely with David Fraucht, for some of you may know him from his days as a legislature, and he's on the team as well. And we are the staff to the governor in terms of advising him on policy issues and how they intersect with, how DSHS is working to support the community and we're the ones, giving him advice about how to proceed in terms of priority setting. And so, what else can I tell you? Just so that you're also aware, I do have a pretty broad portfolio. So this is an area that I work on. In addition to human services generally. So I have DSHS as one of my agencies. And so I've got I guess it's now the Home and Community Services Division as well as part of the Behavioral Health Administration as part of my portfolio. I also have the Economic Services Administration and Vocational Rehab. And I also cover human services in commerce as well. And so in the community services division, and that includes, homelessness and victim services and other things in the community services administration over at the Department of Commerce. And then I have civil rights and immigration as part of my portfolio. So there's a lot going on right now, especially as it relates to our interaction as a state with the federal government. Federal government has a lot of intersection with all of these programs across state government. So it includes everything at DSHS as well as in commerce in terms of supporting vulnerable community members. And then we also have a lot of programs that enforce the rights of Washingtonians, such as our Human Rights Commission and various commissions that support the needs and try to provide input to the government. So a lot of things happening, and I am trying my best to not have this work be just reactionary. And I have to say thank you very much to Brandy as well as Stacy and others that have, given me a lot to think about and helped educate us about the needs in the community and all the amazing advocacy and work that you all have done over the years to put together our system and to try to strengthen the resources that are available to folks in the community, to parents and to kids and adults that are wanting to participate in our civic life and engage in work and in community. And so it's been really, really eye-opening. And I really appreciate the time that everybody's taken to help me get up to speed as I learn this area of work. And alongside, the work that I've done for over 30 years, which has primarily been in the space of victim services and community services, as well as in the economic services, poverty reduction space, and along with immigration and some of the more civil rights related issues. And so I guess what I can say today is we are in the middle of budget exercises. As you are likely aware, the governor is due to release his proposed budget to the legislature and the public. The deadline for that is December 23rd. And we are working really hard to try to not have it be that week because it's people would like to go on a holiday, I believe, that week. But we're trying really hard to get it done before that. And at the rate we're going, I don't know that we will because there's a lot of decisions that are really hard that the governor is having to make. And I will say that, anything, that we tell him, well, if you take this reduction, it's going to have this impact here. It's going to impact these people. It's going to show up over on the other side when, this particular service is not provided. And so it'll show up, the cost will show up somewhere else. And so we are doing a lot of that. And so he's doing a lot of, okay, hold on, let me think about this more. And so we're not getting, it's not moving as quickly as we understand we need to be going to get the decisions out the week that he would like. So we'll see what happens. But I will say we are trying our darndest to make sure that folks, are able to maintain as many services as possible in the challenging environment that we're in. And I don't, as somebody who sees how all the different areas intersect, because I have food in my portfolio as well as homelessness services. I mean, the challenges are really hard in terms of figuring out the places where Washington has invested a lot over the years, and what makes Washington such a welcoming state. Those are the places where we have the room to cut, or not really, but Washington has made a lot of choices around supplementing some of the federal programs, and those are the places that, for better or worse, are, we're looking at having to potentially make reductions. And so I will say, with what's really challenging is that, the federal government has cut back a lot and will be because of, some HR 1 that was passed this summer. I mean, we're going to be seeing some really big impacts on caseloads, both related to food assistance as well as Medicaid. And we're, trying to figure out if there are alternative ways to support folks in terms of providing resources. And we know that there were a lot of big cuts last year already, and we're trying to minimize additional cuts, but I think that there will be some, and unfortunately, there will be some in all across the board in DSHS as well as in Commerce and in other in HCA and all the places that Washingtonians get access to supports. But we are doing our darndest to make sure that those places where people are going to be most severely impacted. We're doing our best to try to minimize those. I will say that what we've observed and what many of you may have observed last year was that if people are already receiving a service, the governor's priorities have been to try to not cut those. Unfortunately, we will, I think, see some of those this year, but his direction to all of us has been no new programs. So there's that. Requests for new programming or additional programming have not been very supported. And so to the extent that that you all are working with legislators on that, if there is a desire for increased investment in something, to not frame it as a new program is my recommendation to folks. And so what else would I would say? And he's also prioritized, not taking away services. And so there, as you, I don't know how to say this. It's just really, I will say my job the last few weeks has been really, really challenging because I see how everything intersects. And unfortunately for my colleagues, even in the outside of my portfolio, I see how things intersect in terms of the importance of resources and programming and enforcement too, on the civil rights side of different protections. And so that's all I can offer at this point around that. I can't say a whole lot more other than we're doing our darndest. And I also was going to say that, this is the governor's recommendation, and he's obligated under the Constitution to provide a balanced budget to release one. And it's just the first step. And you may or may not agree with his decisions. And there may be others. The legislature may have a different perspective. And so I would offer that as well in terms of, where we're going. So.
Thanks, Grace. No, we really appreciate that you're here. You've been a really good listener this last legislative session and now, and we know you know this, but equitable cuts hit us pretty hard because our folks are in a multitude of systems. So they experienced cuts in each way that had happened: housing, healthcare authority, DDA, DSHS generally, SNAP.
Yeah.
So we know you're carrying that message forward to the governor, and we really appreciate that. It's our hope that if he has any questions about how this impacts our community, that he'll come and listen to us. We've had the pleasure of having former governors come and hear us directly, and we always invite that. If there's any way for that to happen, we appreciate it.
I encourage you to, make those invitations. I mean, I have come to appreciate how many really different, I mean, I have a lot of different issues in my little box. And then he's got that, 50 times over. And so I know how challenging it is for him to be able to find, to be able to step away for several hours at a time. And so, but I encourage you to keep trying because, sometimes like those calendars, that happens to be, there isn't 10 things happening at one time. So I would keep trying and don't be discouraged if, he doesn't make that one, that one invitation or that second invitation. I just would keep trying because I'm seeing his calendar and how it gets filled up and how he gets pulled into all the different ways he does and then a lot of it is often because of the latest news story or the big thing that DC chose to do that day. So I would just encourage you to keep trying.
Thank you. We will. I think that's an invitation to all of us to all keep trying.
Yep.
Well, we appreciate you so much, and we're grateful you could come on today and say hi to everyone, so everyone gets to know who you are.
Yeah. And please feel free during session. I mean, I'll admit I am a bit of an introvert, so come up and say hello and introduce yourself because I may not remember you, but I'm also just not one that generally will go up to strangers and say hello because that's just not, I'm putting it out there now. I am a little bit of a shy person, so but I encourage you to come and say hi. So
that's great. Wonderful invitation, everybody. Thank you so much, Grace. We are glad that you're here today.
Yeah.
All right. Lots of emojis there for you. We're going to move on to our next issue. And we're going to start with Hodan Mohammed and Ayan Elmi.
Oh, Stacy, Emma Palumbo's here.
Oh, Emma's here. Okay, Hodan and Ayan, you got to hang on
Sorry.
just 1 second. Okay, hi, Emma. It's my pleasure to introduce Emma Palumbo. She is the Government and Community Affairs Director for the newly formed organization Behavioral Health and Habilitation Administration. So she's our main contact to BHHA, which, as all of you know, in our world is where supervision and operational aspects of the RHCs, some of the children's facilities are at. And we welcome Emma here. Emma's going to work on policy for BHHA and share some of that with us. Emma, are you able to come off mute? We have Emma. Maybe she stepped away for a second.
Maybe she stepped out for a sec because she's not here now.
This is Brandy. I see her here.
Oh, she here? Okay.
She's here.
Yeah, we're not able to hear you, Emma. And we had the same thing happen. It may have some glitch to do with coming in as Kathy. I don't know. But maybe popping off and popping back on. That seemed to work for Grace.
Are you able to hear me? No. Okay.
Oh, yeah, we got you. There you are.
Oh, you got me?
Hi, Emma. Yeah.
Amazing. Okay. Thank you so much. Good morning, everyone, and thank you for having me. Thank you for your patience with my audio. I am Emma Palumbo, and as Stacy mentioned, I'm the Government and Community Affairs Director for the DSHS Behavioral Health and Habilitation Administration. Again, that newly established administration after the DSHS Reimagine. I previously was in the same role with the former Behavioral Health Administration, so having the facility side of the intellectual and developmental disabilities portfolio within DSHS is new to my work this year as well. Very happy to be here and happy to be hearing and learning from folks as well. in joining today. So for the upcoming session, the Behavioral Health and Habilitation Administration, we don't have any agency request legislation that we're pursuing this year. And we know well, as many folks others have already said, that the budget environment is going to be really challenging this year. So we're going to be focusing our time and our work on working with leaders like Rep. Farvar and others on bills that she mentioned and other legislation that's impacting our work. Of course, working closely with Grace, who was just on before me, and others in the governor's office. And happy to be working with many folks on this call as well. So again, if you are in Olympia, I'm there as well at times. So happy to be meeting folks in person. As Grace said, I'll extend the same offer of please feel free to come up and introduce yourself, or happy to be having conversations and meeting with folks. And so I know time is pretty short today, and I believe DSHS Secretary Ramirez is upcoming on the agenda as well. So I'm happy to pass the rest of my time to her for the DSHS updates. But again, thank you for having me. Looking forward to working with folks, meeting folks who I haven't worked with previously, and happy to be working with you all for the legislative session.
Thanks, Emma. We really appreciate you coming in and let everybody see your face. We know you're important to our work, and we really appreciate all the collaboration. That's great. And Kathy, do we have Secretary Ramirez on yet?
Let's see. I see B is here, but I don't see Secretary Ramirez. Let me look closer.
That's great. I did not ask B this, but if B is here, B, do you want to come on and say hello to everybody for 1 second?
Sure. Is my audio working?
It is.
Yay!
It is.
The small little win for a Monday. That's wonderful. Good morning, everyone. My name is Bea Rector, and I'm the Assistant Secretary of Home and Community Living Administration in DSHS. And we have Adult Protective Services. We have the regulatory division over the licensed and certified settings that serve people with IDD and DD, as well as a new division, Developmental Disability Community Services, which is the case management, eligibility, and community contracted side of service delivery for people with IDD and DD, as well as Home and Community Services Division. We serve individuals with functional impairments and disabilities, and that includes individuals with intellectual and developmental disabilities that may choose to be served in that division and or don't meet the statutory definition in the state of Washington. But nice to see everyone. I've been popping in and out this morning. Really great to hear kind of the priorities that each of the organizations have, and really happy to be learning along with a lot of folks around the important work that needs to be done in support of your communities.
Thank you, B. And just a reminder to everybody, B was filling in as the temporary secretary of DSHS for a bit before Secretary Angela Ramirez was recently appointed, and we're so grateful for that work that you do, B. I know you're just always thinking so much about the system and how we can improve it. We're very happy to have you back at HCLA and paying close attention to our home and community-based services. You're going to be a real champion for us, we know. So thank you.
Thank you. Happy to be back.
Great.
I think Angela may be here, but she, just need her to rechange her name, I think.
Great.
Yeah, how am I, Kathy?
That's me. You got my.
How do I change my name?
Go to the corner. We can fix it for you.
Yeah, we can fix it for you. We're so happy you're here.
Can I be
Right.
I'll be Kathy for the day.
That'd be interesting, huh?
Yeah.
Well, welcome, Secretary Ramirez. We're so excited to introduce you to the developmental disabilities community. We have about 126 people on now. We've had some people coming in and out, but I know everybody has been very excited by your recent appointment, and we'd just love to hear a little bit more about you and have you talk a little about, your crystal ball and what you think we're going to be faced with this legislative session.
Definitely. Well, thank you for having me. My name is Angela, although now my nickname is going to be Kathy, so I'm glad to start there. Let's see. I am in just wrapped about month 2 in this job, and I'll give you a little bit about where I came from, what I've learned and seen in the previous 2 months. And then what I would love to do if it works for folks is I would love to take this opportunity to have some amount of time to hear from you guys. What do you think I need to know? I was talking to some folks earlier today about this being my first time living in Washington State. I'm originally from California. My first time working more than a year in state government. I did 1 year in the state legislature in California. It's my first legislative session here. I'm learning not just new acronyms and new programs, but new people. And so there's so much to learn. And you guys have, from everything I've read, seen, as I've met with some of you, have been just really strategic and thoughtful about how you put some of the issues that so many of us care about on the table. So if I can be a little bit greedy and ask to also hear from you in part of my time, that would be wonderful. But I'll take any questions too. Happy to have a bit of a back and forth. So let me tell you more about where I come from. So originally California, my parents were both farm workers, and they really imparted in me and my brother an interest in public service and wanting to give back, not just communities that we came from, but just generally to good government programs and to support public servants that helped my parents and their communities so much. Growing up, I mean, they took advantage and needed a whole host of things, from housing supports to language supports and food and education and everything in between. And they would say that is a huge part of why they were able to have a lot of success in life. Not everything, of course, you work hard. Of course, there's self-advocacy. I know folks here know all about that, both the hard work and the advocacy part. But at the end of the day, you need systems to hopefully meet you where you are. I can have a much longer version of my bio, but I did rebel as a teenager and early 20-something. I went into comedy writing, in part because I didn't want to be like my parents, but also because I loved the creative process and I loved being able to go into a room with something I thought was interesting and let it get kind of kicked around the table a little bit with my colleagues. And I did some performance, I did some other things in the creative space, but the thing I really, really loved was that writer's room. And while I eventually realized my parents had seeped into my head and I was actually a public servant, the feeling, the energy I love, the day-to-day work I love more than anything else is truly that collaborative writer's room nature of bringing people to a table and kicking an idea around and seeing how it can be as good as it can be. And so from being a comedy writer, went into government, state legislature in Sacramento for a year, local government in New York, and then DC for the last 26 years, mostly on the Hill, mostly in the House, mostly for Chief of Staff to now Senator Ben Ray Lujan. Then one day out of the blue, got a call from what would become the Biden transition team and was one of the 7 original hires to help stand that up. So that was a real lesson in how you create a structure that ultimately would become the federal government for the Biden administration, and how you not only bring people to the table, but wholesale cloth, reimagine, re-envision things for what would become a very robust 4 years. I'll put it that way. And then from there went into the White House, did legislative affairs, leaned into how you get the legislature on your side, but also how you respond to the legislature and making sure that you were doing as much listening as talking. And then after that, after a year in the White House, went to sort of, as I jokingly say, the professional love of my life, Health and Human Services, ultimately as Chief of Staff. After January 20th, put my laptop in a box, put it in the mail. They were very, very clear about, noon on the 20th. And then took a beat to kind of look around and think about what I wanted to do with my life, which is, what a wonderful luxury to get to think about that for a moment. And what a lot of friends and sort of the universe kept pointing me to were 2 things. They pointed me to State government, because the way I would talk, my friends would tell me and my mentors would tell me, you sound like a state government person. You like to make things happen. You like government and public service. You like being in the field and like reacting to regular people. And the other thing that kept coming up over and over again was Washington State. Some of you have heard my story of the first time I came to the state. I was a teenager and my brother and I were huge Twin Peaks fans. And we forced our parents, who had no idea what the show was about, to come up here, and we got the pie and like toured around and had a tremendous time. And I just fell in love with the region and had this moment of being on a ferry coming back from Canada, just feeling like in my bones I needed to live here. So if point one was that I love state government and this felt like a good home. Point two was just that Washington State felt like the place I wanted to be. And that was not just backed up by my teenage self, but I kept hearing from folks in DC and across the country over and over again that Washington State was the best of the best of the best, and that it was, the most innovative, had tremendous talent, had enough infrastructure to actually execute on some of these innovative ideas, had all the right sort of like baseline values from workforce and family supports and everything in between to make the work not just exciting and interesting, but truly impactful and something that you can execute on. So when this position came up, well, I hadn't intended to jump in to something. For me, it felt very quickly, perhaps not for others here, but jumping in. But I saw this come up and it was like the stars just aligned of the place I wanted to live, the type of work I wanted to do, the people I wanted to do it with, and the values that I saw being picked apart in different ways that I really wanted to lean into. The other thing to bear in mind, again, a big part of why I want to cut myself off and hear from you is I have never given up on that writer's room mentality. It is ingrained in me, and I know there's not only things I don't know, but people I don't know. And at my very first cabinet meeting here at DSHS, I read a blurb about the importance of relationships. And I spent 20 years on Capitol Hill in DC, getting to know members of Congress and staff and other local leaders and national leaders. I desperately want to have those types of relationships with all of you so that as I'm heading into what is going to be a really tough time ahead, I not only have the types of people I can call for advice, but I can have that writer's room with all of you where you can kick around my ideas or I can kick around yours and we can emerge stronger. That's a little bit about where I come from. Maybe I'll pivot, and I am watching the clock. I'm going to cut myself off, I promise. But a little bit about what I've seen thus far, maybe before a little bit into the crystal ball, as you put it, to the extent any of us have that crystal ball. Some of the things that are top of mind for me right now is to maybe I'll piggyback off the collaborative nature. So I mean, you guys know it best. Just look at the folks on this Zoom, right? Like, it's not like you wake up every day and naturally agree, I assume, but you find ways through to collaborate in a way that, as I've seen it, both from DC, but now that I'm here, that have truly moved the ball forward, and a lot of the supports and efforts that the communities we both care about. I am desperate, as I know the governor, for that collaborative nature and that sort of one door that a human being can walk through, or pick up the phone or go on the internet, that one space, that one place, so that they get information in a way that is truly customer facing, and easy to digest. If I had more time to talk about myself, I could tell you about some of the projects we did at HHS, but the short version is we put a lot of effort in. I put a lot of effort to make sure the content we were putting out made sense to people. People don't wake up and think of themselves as a person who needs housing or a person that needs food or a person that needs job training. They think of themselves as a person, and then they go through their day and look for these different things. And if we can streamline that and make it in a way that is palatable to them, that meets them where they are, that is what I am here to be here to accomplish with you. The other thing I wanted to say in terms of things that I have learned in the first couple of months outside of the importance of collaboration and a one-door customer-facing experience is how do we look at these really tough things and make sure the right people are at the table. So, you know, B was very good, and other people I see on the screen here are very clear about the nothing about us without us, right? And that is like burned in my brain now. There's a few things that are that I, you know, they are pithy phrases, and that is one of them. And so as we are going through what we know are going to be very hard times ahead, whether it's because of what's coming from the feds or what's coming from other channels, we have to have tables that we can come together around, and we have to have the right people at the table. And what I've seen is, you know, while I am new here and still learning all of these different things, having, for example, B at the table has made the work better. So my thing that I think about at least once a day, but oftentimes much more frequently, is who are the right people around this table? And while we might think of certain communities in certain spaces, we don't necessarily only need to think of them in those spaces. Again, they don't wake up. No one wakes up and thinks of themselves as X, Y, or Z. They think of themselves as a human. So how are we, as we're creating this collaborative table, who was at that table in creative, innovative ways that might be a little bit different? I think the last thing I'll say that I've learned thus far is how do we build on the past successes that we've already seen? So, you know, I was on the federal side during the pandemic and saw so much good stuff coming from Washington State, so many amazing community supports that were coming out of the state. It truly did come across my desk. You know, we had so many 10,000-foot federal level things that when a state would pop, it meant they were doing something really unique and special. It also meant they had perhaps a really supportive and vocal federal delegation, which you guys also are fortunate to have. But it rose to the top, and we saw what can happen with these types of community supports. And as we're thinking about where we need to go and the tough times ahead, I'm really interested in, sure, we might need to be innovative. There might need to be new ways to, you know, reinvent some wheels, but there might be some wheels that are working pretty well, or wheels that we want to build off of. I'm now mixing metaphors. You don't build off a wheel, you know where I'm going. But how do we build off of the successes that the folks on the screen and the folks across the state have had? And some of those, I think we learned a lot of good things coming out of the pandemic, including how to make our communities as strong as possible. Moving forward, so crystal ball, and I'm going to do this in like 60 seconds, if that works. Look, I'm not going to break any news. The governor and the press and everyone have been really clear. It's a tough budget cycle, right? And so that's point one. Point two, I'm not breaking news to this crew. Like, people have seen what's coming out of the federal government. There are like unique different ways they're coming up with to make certain things really complicated, from HR 1 to you know, the types of information we're reporting, to the timelines they expect us to work off of, plus the freneticism of sort of like where they necessarily want us to go. It's a really tough time. But I think what I am excited about, to bring it sort of back full circle on the importance of having that collaborative table, is when we are kicked down, when we are forced to do more with less, when we are given directives that aren't always clear, there are sometimes interesting opportunities that come from that. Whether that's interesting opportunities to change the way we decide who's around that table, who the manifest is in the meeting, what we want to hear from someone about, whether there's innovation around how we're using some of the things we're reporting and maybe combining them in interesting, innovative ways, whether there's ways to use technology in ways that might be new, different, and helpful. I know, you know, always top of mind is how to make sure technology is not just a concept for some, but for everyone. Or whether that's a new idea that I can't even conceive of because it's going to come from one of you. So I will say thank you so much, not just for taking the time to talk with me and meet with me. Again, I've met with some of you, the ones I haven't met before. I appreciate all that you're bringing to the table, but also thank you for what's to come. When I was joking with my colleague and friend Ryan Moran from HCA, because we both came from the East Coast, him from Maryland, I was from the District of Columbia, and we were like, these are hard times. And I think if people sort of knew what we walked into, like, or like, what do people think about the types of folks that take these jobs when such difficult times are ahead? Are we masochists? Is the joke on us at the end of the day? And then we kind of looked at each other and just agreed, like, we knew the work was going to be there. And I think, I'll speak for myself. Like, I really wanted to jump into something. That was really hard and really important and really impactful. And what I've seen from you guys, what I've seen from my colleagues here, this is really important and it's really impactful. So I will cut myself off there and say thank you for the work that you are doing. Thank you for being willing to raise hands and have your voices heard. Thank you for helping us do what we do, but making it even better. And this is not just lip service. I genuinely do want to hear from you. I want to know, what are the best practices I should have in my toolkit as I'm heading into my first session? What are the things that are on the table from last go around that keep you up at night? What do we need to think about in terms of new innovations? And what else do you want me to know? And with that, I'm going to go on mute.
No, don't go on mute. But thank you. It's wonderful to hear from you. And I hope you will think of us as your writer's room. We have a long history of trying to provide as much information as we can to the important and inspirational people that are in your position. And we know this is hard work. We're grateful that you've taken it on. I can see you taking a breath like, oh, okay. We know that too. And we do want to be here to support you. Absolutely. I don't think we'd have enough time today, even if we tried, to give you the kind of feedback that we know you need to have. But there's a couple of tenets that I think are important for you to know and hear. You mentioned opportunities, and we're in this weird situation of having to advocate right now to protect a system that we know does not meet our needs. It doesn't meet most of the needs of people here. Even the people who are receiving services often don't get their needs met. And Washington's unique in its innovation, but it's also unique in its underinvestment in developmental disabilities. And so you've heard this statistic, we're sort of around 38th in the nation of investment for home and community-based services for people with developmental disabilities. And this is no longer a debate. Home and community-based services are the choice. It is the way that people want to be served. We have a Swiss cheese system. So you see a lot of gaps and holes, and you're going to hear why some things don't work. And some people end up in places where they don't want to be. Some people don't get crisis stabilization. Families don't get respite. We have these things that we need to fill in to make it a whole system. And we mostly know what that looks like. So working together with you is one of the most important things you could offer to all of us, and we're grateful for that. There's a couple of questions in the chat. One is knowing that we have this new umbrella of home and community-based services being all together now under HCLA with age-related disability, acquired disability, and developmental disability. That's a unique, wonderful new situation we think will offer a lot of advantages. But there is always the fear that people with developmental disabilities, because we're such a small population, will be overshadowed by the aging population and the strength of aging advocates. And I think people want you to know that we want to make sure you see us for the unique problems that we bring to the table and the solutions that we can have.
Can I say?
And then there's another question too about just senior families, making sure you know that we have over 2,000 identified families who are in their 70s, 80s, and 90s who are still caring for their sons and daughters with developmental disabilities. And given the system, we have no way to plan for them for when they can no longer provide that care. And so those are two great issues that come up often.
I'd like to respond and then maybe ask a follow-up question or two. So on the communities being overshadowed, boy, does that resonate with me as something we need to keep an eye on. And I know you guys know Bee really well and know that this is something that's near and dear to her heart too. I think, as you noted, our hope with some of this is that this is a streamlined, one door, easy place where people can go and not feel kind of batted around. I'm wondering if there are ways, systems, mile markers, whatever it is, such that we can make sure we're meeting the marks that of not being invisibilized. Because I know we don't want to do that. And I would be open to, and B, please jump in if there's anything you want to add on this, but I would be open to understanding with some maybe even specificity of like what would success, or perhaps I appreciate that you said you're in this awful position of having to fight for not a great status quo. What would sort of status quo, or what would okay look like? Is it certain check-ins? Is it certain metrics being hit? Is it, X, Y, or Z? Since I know if we kind of say it out loud and have an understanding of what that looks like, then maybe we would do a better job of making sure nothing gets overshadowed. The other thing I wanted to talk about on senior family caregiving, again, something B has found me on multiple times and we talk a lot about. So a lot of confidence and her leadership and understanding of this issue. I think for me, the silver lining in this is that the aging of the state and our population is something that is so common that on some level, while there are certain things that are unique and we want to make sure they are protected and not overshadowed, there's a baseline understanding of aging and caregiving. And so what I would ask your guidance and assistance on, and I suspect this is already happening with B, is how do we make sure in that like larger discussion of aging and caregiving that we're not losing sight of any community, of any angle, of any element that we need to make sure is top of mind. Because I feel like those conversations, I mean, the aging of the state was something that was in the job description and the prospectus. And, the governor's folks clearly had drafted that and, edited it and that kind of thing. And they put that in the top of mind. So how do we build off of that top of mindness and making sure that the perspectives that you guys bring are top of mind within that? B, is there anything you'd want to add in this?
Just a recognition that I've certainly heard this concern about loss of priority or loss of identity, and have heard it on the aging side as well. So, I think, we have a commitment to what works for people. Humans, as you said earlier, Angela, often is very similar, but it is different based on age, based on where you are in your life course. And there are specialized services that we need to make sure we maintain for all populations. And those unique services look different if you have a dementia from if you need habilitation and supported living and supported employment. So definitely that is top of mind for me, is making sure that we're able to kind of find that balance in this new.
Very optimistic. B led aging through a 10-year plan through former Governor Inslee to make aging number 2 in the nation under HCBS. And we would like a plan as well. That is top of the Community Advocacy Coalition's agenda that we featured earlier today. We know that we need a cross-biennia plan for investment and change to expand the home and community-based system for people with developmental disabilities. And you'll see in the chat, number 1 is, do you have any experience closing state institutions? We don't want to go back to segregation and institutional care by default, because that is where HR 1 places some level of protection. It's not for home and community-based systems, it's institutional care. and we don't want to go back. We, in fact, had a speaker earlier today talk about the importance of recognizing the history of treatment of people with developmental disabilities over time and reconciling that clear acknowledgement of the ways in which we've treated people with developmental disabilities and how we make sure that we learn from that past. So you'll hear that a lot. Will you talk to us about that? The ARC, in fact, has a 90-year history of looking at the role of institutional care. And we want to make sure that we're careful about how we make that transition, but that we focus on home and community-based services. And I think we have time for one question from Ivanova, and then we should let Secretary go along with.
Hello, this is Ivanova, and my question to you, would you be willing to meet with the South Advocate community to hear what our concerns are directly? I think it would be really important for you to listen to the people being served by these services to understand like the trauma that has happened to us historically and what the South Advocate legislative priorities are. It'd be wonderful if you'd be willing to do that. Thank you.
Thank you for the question. And can I say, as a former congressional staffer, I always appreciate when someone's like, will you come and do X, Y, or Z? It's like to the point, and it's why folks here are so effective. I will definitely do what I can. So I want to say yes. I also know I have a scheduler who sometimes tells me no, but schedule permitting, I would love to. I might just need to beg a little bit of patience as we kind of like figure out what I'm able to do and when. But if and when we are able to do this, I'll put on the table a couple of things. I would love to have a really diverse group of people from different parts of the state if we can pull that together, because I know sometimes I'm looking at some of you, I know we talked a little bit about this, sometimes in more rural parts of the state, services are uniquely challenged, and sometimes in urban parts there are other challenges, and sometimes in Indian country versus non, and there's just a lot of nuance to this. And so absolutely open to meeting with folks. We'll trust your judgment on the right types of folks to bring to the table, so I get a full impression of what the realities are. And maybe I'll close with this in the last couple of minutes we have. I appreciate that you brought up, both of you at the end here brought up the complicated histories of treatment institutions. And, you know, I'm a naturally pretty positive person. I think that's part of the reason, again, I wanted to do some of this work, was to jump into some really hard things during some really tough times. But boy, when you read about and hear the stories of what folks went through in the past, it is heartbreaking, and you don't want to take anything that we have for granted, and you also don't want to go back there. And I think we've learned throughout history that if we don't know what it is, if we're not really taking a hard look at where we come from, we're always going to be a little bit at risk of going to places where we have no interest in going. So please know, I know we've talked to some of you about protecting some of the records, and those types of things are really absolutely on the table. If there are things related to that, please follow up with myself and B. But know that regardless of where we take this train in this tough budget climate, I always want to make informed decisions based on what I'm hearing from, whether it's Inova and her colleagues or other folks who are not on the screen today, but in our communities. I want to make sure I'm centering you. It was the directive from the governor that this be a consumer-friendly, customer-facing experience, that we leave no community behind, that no one is overshadowed, all while looking for efficiencies, all while trying to optimize a positive experience. And I think, you know, that's a very positive, forward-looking thing, but we can only do that if we're taking a really cold, hard look at where we come from and what we need to build off of. So I really appreciate this group, not just because of where we're going, but also because of where you and all of us are coming from. please find me again. Please, I know you find B, so we don't have to make that plea, but please find me again. We will follow up about meeting with some other folks down the road or as soon as we can. But in the interim, if there is something you need from us, if there are perspectives, opinions, etc., like find us. I will only be as good as the information I'm getting from all of you. And you can't have a writer's room without co-writers, and you guys are my co-writers in this experience. And I look forward to the hard but important days ahead.
Thank you. We're grateful. We hope to keep your sense of humor. We're going to need that skill.
I'm gonna try.
We all try.
All right. Take care, everyone.
Thank you.
Bye.
Take care. All right, everybody. Thank you for that airtime that we got to have with these folks that are really going to influence what happens in the future here. We are going to move forward now. It is noon. Kathy, everybody, what's the consensus? Should we take our 30-minute break for lunch and then come back with our speakers? Does that make sense? The most sense? Okay.
And thank you, Hodan and Ayan and Therese, for being patient. We'll have a couple of legislators when we get back, and then you'll have your opportunity to talk about your issues. It'll be a little bit racy. Quick race through the end this afternoon.
Racy in the race sense, not otherwise racy.
Right. Sorry. Race through.
We're not usually a very racy group.
No.
Hey, everybody. You can either pop off and come back in or just put yourself on mute and video and have a good lunch. We'll be back at 12:30 exactly.
Thank you.
Kathy?
Yes.
This is Karen. How long are you expecting to go this afternoon?
Till 1:30.
Till 1:30. Okay. And are you having multiple legislators coming in? Is that?
There's either 2 or 3 right after lunch, and then we're just going to finish off the issues and should be done.
Okay.
What time do we come back from lunch?
12:30.
12:30. Okay. I gotta go quick to the gas station then. Thank you.
Okay. Bye. Oh, I should. Okay,
All
I'm
right.
going to stop the recording. Help me remember to start it.
Because you're.
It's not just Kathy, it's happening to me too.
Yes.
Yes, we can hear you.
Yep.
No. Nope, still can't hear.
Nope, I don't hear her.
How come some of us can hear her and some of us can't?
That's weird.
Brandy, does it have to do with the channel for the interpretation? Folks if they came back
Oh,
in,
yeah.
go to the English
Oh,
channel?
yeah. Everybody hit the English channel if you're listening in English and the Spanish channel if you're listening in Spanish. It could be that.
Mm-hmm.
The little globe at the bottom.
There we go. That's it.
Okay.
All good.
I
Hear
still
her.
don't
That's
hear
a new
her.
problem.
We have
We can hear
interpreters
you
today,
now.
so.
This is Diana, and I still don't hear her.
So
Diana, you're
if you're
also
having
really
trouble,
low.
go
Did
down
you-
to the globe where it says interpreter, and then hit the English button on the globe if you're having difficulties.
Okay,
There you go. But you can hear her now.
now I hear her.
Thanks, Rep Taylor. As always, it's very amazing to hear that you're in all the right rooms, saying all the right things. We really appreciate that about you. And I did put the link to the symposium in the chat for those of you that haven't had a chance to look at some of those presentations. That all came about because Representative Taylor advocated for some funds to create what she's talking about, her very own vision of ensuring other states and state legislators have the support of each other as a cohort to do the right thing, and that Washington State tries to serve as a leader as much as possible in the conversation. So thank you so much for that. We really appreciate it. And we know that you see us as collaborators in this effort and always appreciate how much you reach out to us and try to make things happen. So thank you. Thank you.
Thank you.
Kathy, do we have Representative Macri?
I don't see her in the room yet. Let me see, double check.
All the comments here in the Q&A and such are hearts and thank yous, Representative Taylor. And we see your kitty as well.
Mhm.
There he is. That's great.
So should we go back to Aaron?
Yeah,
Because
I
he
think
needs
if
to
that's
leave.
okay, Rep Taylor, since there's no other questions, we're going to move through the program. We're a tiny bit behind. And up next, because he has to leave at 1 o'clock, is Aaron Dixon with the Community Employment Alliance. Welcome, Aaron.
Hello, how's it going? My name is Aaron Dixon. I'm from the Community Employment Alliance, and I'm here to talk about our bill that we are working on this session. And the bill aims to lower the age of eligibility for supported employment and community inclusion services through DDCS from 21 down to probably 20 this year. So our bill last year was 19, but knowing the budget situation, we're amending it down to or up to 20. And so essentially what this would do is, so currently, if an individual is, 18, 19, 20, currently, uh, there isn't a way to access supported employment or community inclusion services in the same way that adults do. And the reason that this is important is that, so for people who are in that age range, they're typically often in a transition program at their school up until formerly age 21. It's now been moved to age 22. And most schools are not in a position to support someone if they get a job, especially if that's a weekend job or an evening job or a job of a pretty significant number of hours. And so that's a current problem that we have in our system. So passing this bill would work us towards younger individuals having the opportunity to have someone to support them in their job uh, when they're younger in a way that schools are not typically staffed to be able to do. It would also allow community inclusion at a younger age as well. So part of what we're hoping is that having people access these services younger will kind of help smooth the transition before you get to the services cliff when people exit their transition program. So that's part of what we're working on as well. And then also our goal is, we want to work towards individuals with disabilities having as much as possible a similar experience with employment as their peers without disabilities. And the way our system currently functions, people are often getting jobs when they're 21. And so we want to work towards having it look more like it would for the rest of the population. And also, there's data that shows that the younger that you get a job, that you're more likely to have more earning potential throughout your life if you get a job earlier than 21. So, that's something that is important as well. And then also, too, just the fact, our longer term goal is to work towards lowering the age all the way down to 18 or even 16 if we can pull it off. Because again, most people without disabilities get their first job around age 16. And there's a lot of opportunities for networking and training and getting benefit of the doubt from your employer that you might not get once you're 22. And we don't want people with disabilities to lose out on that. So overall, We have done our due diligence and we've confirmed with OSPI that they don't feel that this duplicates anything that the schools are doing and just enhances what they're doing. So that's kind of the summary of our bill. Thank you.
Thank you, Aaron. I was just double checking to see if there's anything in the chat. And Diana Stedden asks, is there a fiscal note?
Yes, there is. I can grab it really quick and post it in the chat box.
Thank you. All right, Aaron, we so appreciate you briefing that issue. It's really important. And since I don't see any other questions, if it's okay, we're gonna move forward. Thank you. I just wanted to do a reality check. Is Representative Nicole Macri in the room, do we think? Oh,
there she
yay.
is.
Hi, Rep Macri. How are you? Please, I'm really grateful to introduce Representative Nicole Macri from the 43rd District. She's popping in to say hi to us and talk a little bit about her view of the upcoming legislative session and just say hello to us. Rep Macri, go ahead.
She
Thanks, Representative Macri. And we're always so grateful for you being a champion, especially when it comes to fiscal matters and fiscal issues and looking at the numbers for us. We've had Secretary Ramirez on a little bit earlier today, along with Assistant Secretary B. Rector. We've said this a couple of times. We're in a strange position of defending and protecting a system that doesn't really meet our needs. But it is all we have, and then continue to work with you on this larger plan over biennium so that we can really shift our focus to home and community-based services and kind of filling in that Swiss cheese, those holes and gaps that we see for critical stabilization services and that sort of thing. So thank you so much. I know that you're working hard for us, and we really appreciate you coming today. Thank you. We're really grateful for you to say that. It means a lot. We know we're still educating a lot of legislators on that very value-based system, and what we know people really want and can benefit from when we put our money in the right places. So thank you so much. We appreciate it. And if I don't see any major questions for you in the chat, just a lot of gratitude and hearts and thank you. So I think we're okay. Thank you for popping in. You're welcome to stay if you'd like. Take good care.
Thank you.
Okay, now drum roll. We finally get to a couple of the issues that got squeezed out in the middle here earlier. Hodan, Mohammed, and Ayan Elmi, if you're in the room, we would love for you to go ahead now and talk about protecting immigrant and Black rights in the context of our developmental disabilities world.
Thank you, Stacy. Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
Thank you. Thank you, everyone. Good afternoon, everyone. I'm Hodan Mohammed. Most importantly, I'm Ashwaq's mom, a young adult with disability who inspires me every day to be a better advocate. And I also stand here with Washington. I'm the executive director with Washington Multicultural Services, grounded in a belief that family deserve to be heard, understood, and supported with dignity. So this year, the two topics came from our community that we serve, protect immigrants, refugee families with IDD, why this issue was important. Many immigrants' families were struggling with navigating services because of the systems were not built for language, culture, or lived experience. Some of the area that we have previously was happening was families with either have visa or green card, or even if their citizenship or on documents, were really afraid of asking for services. We had families missing their IEP meetings. We will go in, we keep rescheduling DDA services. SSI appointment was the part where we were helping family, helping them guide that process and connecting them to some legal clinics. And just supporting their children with quality, services. For fear of running into ICE was a huge area where we were wanted our families to be protected. We had families in our WhatsApp group where they would say, ICE came to my door today, taking picture. I can't come out today. I'm not able to come to the appointment, asking each other, can you pick up this grocery? In these are area we have seen with SeaTac, Tukwila, Des Moines. And some of the families are citizens, some of them are not, some of them are documents. So they're a mixed group, which were a lot of questions were asked. Family, I'm a citizen, why they're, at my door, right? And the other the result of the delay in the diagnosis, the unmet needs, the long-term harm that could have been, prevent through this early support. So trying to get them the support that they needed, but these families were afraid to follow up some of the services. So why we need to act now, I think fear should never be a barrier to care, and we must ensure safe access services regardless of the immigration status with a strong language support and cultural navigation. So empowering, trust community-based organization, removing fear and building confidence, and ensuring that, families is left behind with simple because of the systems feels unsafe or unfamiliar. So those are the things. And then also what we had noticed was adults. We have a lot of young adults that are trying to become a citizen. And family has to be in that space because they're the guardians. And again, these are families that do not have documents or have green cards. So that was a delay of process of where we had to keep rescheduling the citizenship appointments. So that was another area that we have solved. So the second concern was, as you know, our organizations, we serve African and African American families, and immigrant refugee families with this population. So addressing systemic anti-Blackness discrimination with the IDD services, that was another huge issue that we were also facing that for the last couple of years, that as Washington, we knew this was happening, but just to start in the organizations, we have observed and seen. And why this issue is important is, as you know, Black children are often under-evaluated early, but over-disciplined later, and leading to this loss intervention services. Anti-Blackness is the assumption where influence how behavior is interrupt how families are believed and how services are assigned. These inequity follows into a childhood. We have a high number of unemployment Black youth and adult with disabilities services. We have advocated for them. They have job coach. They're still sitting on their parents' couch and not receiving services and more isolated, these youth. So what we need to act now is the equity requires a different support. It's not an equal treatment. So we must push for the bias for free evaluation, raise bias on data tracking, cultural responsive training. So when Black families feel believed and support and resource, the outcome changes. And we have seen that on firsthand. Belonging, increased independency, growth, and community thrive. So these two issues matter because they determine who receives services and who's left behind. So we must act now so immigrants and Black families are not navigating disability alone in fear with inequity outcomes. Everyone deserves access. Every parent deserves support, and every community deserves equity. So we're hoping this important group that Ayan and I and other member has been attending, that you guys can support these two issues. We're not asking fundings. We know there's a lot of resources that are out there. We just wanted to make sure that how do we implement it so that families who look like me, families who look like the community that you all serve, your allies, are getting the services they need and they're protected as well. Thank you.
Thank you, Hodan. And very passionate and poignant words. I believe that our community stands with you and with the families that you're serving fully 100%. I hope that I speak for every single person in this group, that we will be right there alongside of you, talking about these issues and supporting what you're doing. And we, first and foremost, also thank you for loaning us Ayan to be co-chair of the Community Advocacy Coalition. We're very excited that she's taking on that new role. And we hope that that brings an even louder voice to these issues. So thank you so much. We really appreciate it. I don't see any questions in the chat specific for you, Hodan, just a lot of hearts and gratitude. So we thank you so much. And if okay, we'll move on to our next speaker. And with that, I would like to welcome Therese Fospa-Izadeh, who is from Tavon Learning Center. And one of these days I'll say that without skipping a beat as I say her last name. It could take the rest of my life. I'm gonna get it right.
Thank you,
And
Stacy. You're
Therese,
getting pretty good.
come on. Thank you.
So I'm Therese Feffy today, Executive Director of Tavon Learning Center, also the parent of a 42-year-old young woman. Well, I guess she's not so young anymore, with IDD. And our legislative priority is centered around the Life Skills service. And Life Skills is a service that's available under several of the waivers, including the Basic Plus, the IFS, and the Core waiver. I think it's also available under the SIBS waiver as well. And the purpose of Life Skills is to help people build healthy relationships as well as have improved quality of life and learning new life skills so people can function more independently in the community. Currently, in order to be a life skills provider, you have to have a bachelor's, master's, or doctoral degree in social work, sociology, psychology, education, child development, gerontology, nursing, or other related field, be a certified life coach, or be a university intern working on a program for social work, sociology, psychology, education, child development, gerontology, sociology, or nursing. And so what we are asking for is that years of service be considered when somebody applies to be a life coach provider. Asking that somebody who has 2 years of working with somebody or with people with IDD be able to become a life coach, as long as they're supervised by someone who has one of these degrees or at least 5 years of experience working in the field. The reason why we're asking for this is that it's really difficult to find life skills providers, and we're hoping that this will improve access to the service. We currently at Tavon have between our community engagement and life skills program, have a wait list of about 45 people. So that's our ask, short and sweet. And thank you all for supporting it.
Thank you, Therese. Can you, for just a moment, talk a little bit about the recent formation of COBRA, what that is for everybody?
Oh, sure. So COBRA stands for Community-Based Respite Alliance. And I've only been involved in this legislative kind of work for a year and a half. And it became very apparent to me that the housing people have a voice in Olympia, the supported employment people have a voice in Olympia, but those of us who do community-based respite don't have any kind of voice. The individual providers have the union. And so it felt important to me that we get together, every providers across the state, so we can come up, especially in light of the fact that they're looking at, the waiver restructure and all of these things and how that might impact respite in the community. And come up with a group that will look at things such as standards of care. If we actually get to tiered rates, how are we going to make sure that people who say that they're able to serve people with higher needs are doing it and doing it well? How are we going to make sure that people who say they have these lower ratios have it? And I think standards of care, coming from the nursing profession, I'm all about standards of care. And I think that that's a way that, number one, respite in the community, maybe we can finally get rid of that old-fashioned notion of respite being, 10 people sitting around in a room coloring. The respite in the community programs are really vibrant and active, and they vary tremendously. And currently we have 39 people signed up for the group, and they come from all across the state and have I would say there's probably only a couple who do programs similar to Tavon, where we provide all the personal care without requiring additional caregivers to come along, to people who do more like camps or one-off. The Parks and Rec people are in there as well. So it's a wide variety of people, and we've been around now for just 6 months, so we've got a ways to go and a lot to grow.
Great. Well, we appreciate you sharing that. It's good that everybody knows about that and
Yeah.
all the
Thanks
good
for
work that
asking.
you're doing, Therese. Thank you so much. All right. With no further questions, we'll move on to our next issue. Thanks again, Therese. Next up is Sean Latham, who is the coordinator for self-advocates in leadership. Sean, you ready to go?
This is Sean Latham from Self Advocates in Leadership. Our number one priority this upcoming year is to help phase out / close down DD institutions and make sure people moving into the community have what they need. Our one-pager states, Washington State has a long history with developmental disability institutions, also called residential habilitation centers or RHCs. The first DD institution was established in 1914 in Lakeland Village. At its peak, there were over 4,000 people with intellectual and developmental disabilities living in them in the mid-20th century. As of 2025, we have 4 remaining DD institutions with 413 individuals residing in them. As individuals have been leaving institutions, they have been receiving their services at a fraction of the cost. For example, those in a DD institution have an average daily cost of around $1,800, while those in the supported living program have a daily cost of $625. We ask you to please refer to the 2025 DDA, census and cost data for further information. SAIL members think all people with intellectual and developmental disabilities deserve to live in a community setting of their choice that doesn't restrict their rights. What are we doing to get to this? First, we are following the implementation of Senate Bill 5393 that passed last year. This bill stopped long-term admissions to Rainier and is supposed to stop any short-term admissions by 2027. However, right now it allows residents currently there to stay there if they choose to or, in reality, if their guardians choose to keep them there. We would like to revisit how quickly a closure would occur, as currently, Rainier closes only when there are no residents left. And as the population goes down, the cost to keep Rainier as it is, goes up per resident. We can and should do better than that. We are currently looking at working with Representative Daria Farriver on a few things. Representative Daria Farriver is requesting data from the Department of Social and Health Services to see who is ready to leave Rainier and who really requires high enhanced support. Those that actually need enhanced support may cost us more money to transition them and to support them. It's just a fact, but many can just transition with smaller supports and can be done sooner. We believe the data will show that there are very few people who will need more costly support needs in the community. Representative Farriver is also working on a bill to remove the word school from all of the DD institutions, also known as residential habilitation centers, as an attempt to let people know these institutions are not schools, they are just residential institutions. There has been a lot of confusion from some when we try to advocate to shut down these institutions because of the school term, and we want to make sure that it's clear that these centers are not schools, they aren't even to have kids in them at all, so we will be working on it. In our communities and not in
I'm gonna pause there to save time. But if you want to know more, just contact me later.
Thank you, Sean. That was great. It's a good summary and overview of that issue. We appreciate it. And I just was showing in the chat, Therese is going to put her contact information from the other question about how would people refer providers to join COBRA. So thank you for that question. And We're going to move on now to Deanna Winterrose. Deanna, are you available to talk a little bit about continuing education for family caregivers? Boy, we didn't lose her. Like, you're still here. I might ping Deanna and see if she might have gotten distracted by other things, even though she's on, and maybe we'll move on to
Ramona.
We have an advocate who's talking about ending isolation and restraint.
I'm sorry, this is Ramona. I thought I was going to present.
Yeah,
Oh, great. All right, great. Sorry, my notes just said an advocate.
Okay. Hi, everyone. Again, I'm Ramona Hattendorf with the ARC of King County, and let me put a couple things in the chat here. So I am going to talk a little bit about ending isolation and restraint and give you a little bit of an update. This is not a new issue for a lot of folks here. We've been working on it for several years. I'm sorry. There was a note from Zach, caught my eye. Focusing. So we've been working on this for several years, and we've managed to get some different pilots going. There's some demonstration sites that are that are in the process of working, and that will be live for other schools to visit. In fact, I think those schools can actually now start booking visits now. So we've done a lot of work. We've done a lot of technical support. We've also learned a lot. We're learning more. We're also learning that a lot of what the schools need isn't necessarily like a single day of professional development. They need someone who they can turn to and learn from about ongoing technical support. So we've also got, at the same time, they've embedded this work within the broader work of inclusionary practices, which we've been investing in for a number of years, as well as the broader work around multi-tiered systems of support. I'm sharing this to say that the state's actually been doing a lot of work around this, and they've embedded it in other systems, and they've really built a strong infrastructure. Married on top of that, last session, we got an increase in special education, which helps pay for some of the individualized supports that students use. Not everyone subject to isolation and restraint has an IEP, but 80 to 90% are. So all these things coming together really put us in a really solid space. So the coalition that's been working on this, we're working with legislators now to really sort of narrow this ask, because we know that it will be a lot for school districts to try to do everything all at once. That would require a lot of expense on their part of making sure they got technical support teams going to all grades. So what we're proposing is to start with our young learners, because we know that things like isolation and restraint interfere with the learning and skill building that we need. We also know that it sets them up for more isolation and restraint in the future, and it also causes psychological damage. So we want to stop it before it starts. So we are working on legislation that would specifically address no isolation in preschool, no isolation in transition to kindergarten, and no isolation in kindergarten. So we're starting in the right place for kids. So that is the isolation and restraint. Question, Stacy, did you want to share the related issue around IDEA? And then do you want me to wrap up and go to Deanna, or do you want me to do my second position?
I can quickly share.
Okay. Oh, and before you do, I just want to let people know that there is a coalition working specifically on isolation and restraint. I put that in there. You can visit it, and you can join. And it would be lovely if you would join. Thanks.
Great. And do you see the proclamation, or do you see my desktop?
I see the proclamation.
Oh, you do? Okay, I'm gonna leave that alone. So just a quick shout out to Governor Bob Ferguson's office for recognizing that IDEA, the Individuals with Disabilities Education Act, is celebrating its 50th year. That happened over the week of Thanksgiving, and this proclamation was issued at our community's request. And so it acknowledges the historic role that IDEA has played in establishing rights for children with disabilities to access public education, and making sure that our state realizes how incredibly important this is. We'll post this proclamation within the notebook. Feel free to use it at any point that you're talking with your legislators, to remind them that Washington State was actually the first state to have rights, educational rights for students with disabilities based on our state constitution. We kind of peaked early on that issue and ever since realized the incredible importance of IDEA. With the dismantling of the Federal Department of Education, we know that those rights could be jeopardized, and that when we don't have enforcement, that we are certainly in danger of the erosion of those rights across educational settings. So we just wanted to make sure and share that with you and say thanks again to Governor Bob Ferguson for this. Go ahead, Ramona.
Oh, okay. So Deanna, you popped in. I'm going to finish out and then we're going to
Good.
turn over to you.
She did great.
Okay. All right. So the second position that the Arctic-King County is working on and that the CAC endorsed is, or yeah, I guess you can say we endorsed, as the a progressive revenue. And if you have heard from various speakers, the budget is tight. We've had budget problems for a long time, actually. This is not a new thing. Sometimes we've gotten some federal money that's kind of helped gloss it over, but fundamentally we have a bad tax structure. Those of you who are in these circles might hear it often referred to as a regressive. And what that means is that the people with the least amount of money actually pay as a percentage of their income the most taxes. And the tax system as we have now really leans, first of all, of course, there's a lot of costs down to the local level. And at the local level, they've got two tools. They've got a sales tax and they have property tax. And those really, really affect lower income folks and middle income folks. And so when people are talking about progressive tax, they're thinking about different things. It's not just we want more money. It's we want a steady funding stream that we can plan on so that we can invest in the type of service infrastructure that our state needs and that the citizens of our state deserve. Actually, anyone in our state deserves, whether they're a citizen or not. So, so that's the reason around progressive, and the particular issue as framed that the CAC endorsed is also saying, you know what, if we're going to have progressive revenue going into human services, we want some commitment that it's going to community services and not into institutional care. We understand that legislators will make investments as they need and where dire straits are, but we really need to start thinking and committing to building out the community infrastructure support that everyone relies on. And so that's something we want to make sure is heard by legislators, is that we want you to invest in community. We don't have any specific requests, or it has to be this specific tax or that tax, but we want you to explore taxing. We want you to explore making our tax structure more progressive, and we want you to commit to investing in community services. And that's that one. Thanks so much.
Thanks, Ramona. Yep, I think the good news is usually when we ask the public, do you care about people with developmental disabilities and would you be willing to dedicate a tax source to it? The answer is almost always yes. They just didn't realize it was a problem. So we'll have to keep making sure people know about this. All right, last but not least is our final speaker on a particular issue, and that is Deanna Winter-Rose, a parent advocate. And Deanna, if you're ready, just go ahead and hop on.
Did she disappear?
I'm here. Can you hear me?
There you are. Yeah.
Okay. Can you hear me?
Yes.
Perfect. All right. I'm here today to talk with you about why continuing education should be voluntary rather than mandatory for our family providers. So family providers are those who have a relationship with the person they're caring for, but are not a parent. Providers are already difficult to find and retain, and many people with developmental disabilities feel safest and most comfortable with family members who know them best. That's exactly why the legislator created the family provider category in 2023 to ease the unnecessary training burdens on relatives caring for a single loved one. Under that new category, the initial training was reduced from 70 hours down to 30, and the licensing and continuing education requirements were intentionally removed. The rationale was simple. These caregivers have often known the person they're caring for a lifetime. They've received timely client-specific training directly from doctors, OTs, PTs, and SLPs working with the client. And because of this, they understand the client's needs far better than a standardized class could ever. But in 2024, Senate Bill 5811 changed that. Although it claimed to be only to clarify the family relationships, it quietly reintroduced the annual continuing education mandate. And that mandate does not match the reality of these caregivers or provide the client-specific training that's necessary. We've been told that the training partnership expects to create one new 3-credit course per topic, per topic area each year. And that's nowhere near the 12 credits that will be required for these family providers. To meet the requirements, family providers will be forced to take courses irrelevant to the needs of the one person they serve, which not only disregards the intent of the training, but it would also be a waste of state resources, worsen training backlogs, and discourage family members who make up a crucial portion of the caregiving workforce from providing care. We want to be clear, we support access to voluntary continuing education. If a family provider finds training that genuinely benefits their loved one, they should absolutely be able to take it. But simply making continuing education a requirement and making it mandatory doesn't improve care and only creates unnecessary barriers. The fix is simple. Senator Binky is willing to draft legislation, and Rep. Barnard is willing to run a companion bill in the House. The proposal already has support of the ARC of Washington, the ARC of Tri-Cities, and the Benton Franklin Parent Coalition. We are looking for strong Democratic co-sponsors that will help to move this bill forward. If you have relationships with any who would be interested, please reach out and let's collaborate on making that happen. Keeping continuing education voluntary will protect families, strengthen the workforce, and ensure our ever-dwindling resources are free to be used where they can make a real difference. I'll put my email in the chat, and please let me know if you're willing to help promote this effort. Thanks.
Thank you, Deanna. We really appreciate it. Sorry, everybody. I know she was a little bit quiet, I think, for a lot of people, but we got the recording. We can always turn it up just a little. And we appreciate you talking about this issue again. I think it's had a lot of airtime, and people are starting to really understand the importance of this. So thanks. Okay, we are almost, it's 1:26. We're 1 minute over, but before people jump off, Kathy has a really important Zoom poll for people to take because our funder really wants to know if this is worth our time and effort. So I want to make sure that people get a chance to fill this out, and then Kathy's going to close this up.
Yeah, I went ahead and launched the poll, so you can fill it out, and also it's in the chat box if you need longer time to do it. I'm just going to I want to give you a couple. There's no time to look at all the slides for today, but I want to tell you a couple of things from that and just capture a couple moments. Okay, let's see. And okay, hold on. Where'd it go? Okay.
I just have a question for the last speaker.
Let me see.
I have a question for the last speaker. I put in a question and answer.
Oh, for Deanna?
Yeah, because I just what I would because there's still a lot of people that are not aware of the harm of mental AIDS theory. There's still going to be ways to support families in understanding the difference in caring for your child and caring for your adult offspring, because there still should be a continued education about those topics, so parents are being supported in knowing the difference between supporting a child when they're a child and then changing that hat when they become an adult. And I am afraid that people are not going to get that training if they're not going to be encouraged to take it. So I just wonder if there's any discussion on that. Thank you. For family providers.
Ivanova, currently that training does not exist in the training partnership, and I think that's a great point. That's something that should absolutely be available for family members to take. And as I was thinking about this, I was thinking the most important thing is the client is free to hire whichever person they want to provide that care. So if they have hired someone that they feel like isn't respecting them as an adult, then they can always hire someone else. They could hire a different family member or someone from the pool of providers. So this is in no way trapping the client with someone who isn't doing their best for that client or having the best interest for that client.
There's a lot of people that they want to still be supported by the family member, but they just want the family member to understand the education and the harm. Like they just want them to get educated on why it's wrong, but that's not happening. And people don't want to just be like, oh, I'm not gonna like the family member, they love them. So it's not a matter like, oh, I like it's more complicated. Sorry.
Yeah, I
Thank
can see
you.
how that would be. And with that training partnership and those kind of topics not being covered, I think that's a really important element to bring up with the training partnership and say, hey, this is a serious issue. These adults want to continue having their loved ones be able to care for them, but they need to have some specific training opportunities to be able to learn more about how to make that transition from caring for a child to caring for a young adult and an adult. So great points, Ivanova.
And I'll just bring up just a quick point. The training partnership bought the curriculum from Open Future Learning, is going to make that available. And I think that has some curriculum there that would address this unique need. And so that's all good news. Thanks, Ivanova, for bringing that up.
Yep. Okay, let me close you out. Okay, I just want to make a couple points on the slides. Most of this you can read and look at on your own. But where does the data come from? Most of the data in here comes from the 2025 caseload cost report from DDCS. But I'm going to tell you there are 3 or 4 slides that are from 2024 data because they did not get that information to us in a timely manner. So when you go to the website and you see where the link is not live, those are the ones that are the 2024 data, and we will update those as we receive the data. And I think most of this other, you can look through the data on your own and see the information. Particularly, we didn't have information on some of the average, this slide, average monthly costs for waivers, and then for people working in the community. Again, you should be able to note that when you look at the individual slides in the notebook related to the on the website. I think you should be, and we also don't have information from the budget either.
Kathy, this is Darla. I have a question on the RHC slide, the RHC census.
Mm-hmm.
Oh, never mind. I added wrong. Never mind.
Okay.
Thank you.
That's great. And then there's at the end of this section talks about some of the challenges that you can ways you can talk to your legislator. And I think that is it. So thank you.
I see a hand up, Kathy, and it's Darla.
Yeah. I think Darla talked already.
Thank you for all your hard work, all of you.
Hey,
I'll stop
Margaret Lee
sharing.
Thomas. We love you too. You're awesome.
Oops. Did it stop sharing?
Nope.
Okay. It didn't stop sharing.
No, it did.
Kathy, we
I'll
have